Hello, please I welcome everyone to this meeting of the Health Environment Policy Committee taking place from the Walton Suite in Winchester Guildhall. Time is 6:30. My name is Councillor Steve Crumwayson, Chairperson of this committee. This meeting is being live streamed and recorded to the Council's YouTube channel. Subtitles are available and advice on how to turn this on is set out on our website. Could I ask everyone in the room to please ensure that mobile phones are on silent or switched off? In the unlikely event that it's necessary to evacuate the building, the fire alarm will sound. Please follow all the instructions given to you by our team. And if I could just wrap by welcoming the members of the public and visiting councillors to the meeting, I will invite you forward when it is time to make your contribution. So now turning to the agenda. Can I just start with apologies and any deputies?
Thank you, Chair. No apologies for absence received. All members are present. Thank you.
Okay, thank you. Now if we can move on to the second item, which is the appointment of the vice chairperson for this municipal year. And I'm asking for nominations.
Could I nominate Councillor Brophy, please?
Thank you, Councillor Power. Do I have a seconder? Thank you, Councillor Aaron.
Sorry, yes, I'll second that. Thank you.
Okay. For nominations? Okay, I think we'll call that carried. If Councillor Brophy could make his way up to the seat next to me. Okay, moving on to item 3. Any declarations of interest that we need to be aware of? I'm seeing shakes of the head, so I think the answer is no. Now moving on to item 4, chairperson's announcements. I'll start by saying once we get through the what I call the administrivia of the meeting, we will have 3 major items to consider, and then the 4th item, which is the work plan. I've kind of provisionally budgeted about 45 minutes for each of those major items. We don't have to use the full 45, but just so we have an expectation of how long each item will take. So we could be looking at sort of 2.5 hours up to about 9, maybe even 9:30. So with that in mind, I will be calling a comfort break at around about 8 o'clock, just so that you'll know when that's going to be. And it will be whenever it fits within the agenda. Second item to make you aware of is that the council has received a letter from Hampshire Hospitals, which is their response to the letter that was written on behalf of the council by, I think, Councillor Becker, who is sat over there. A letter has been received in response, which talks to, I think, most of the points that were in the letter from the council, and which, of course, was influenced by the meeting that we had here on the 31st of January. In response to the Hampshire Hospitals consultation. So that letter has been received and it will be attached to the minutes of this meeting to go out into the public domain. Item 5, another bit of administrivia. I've just got to find the right page. It is the dates and times of the next HEP meetings, in fact, all the HEP meetings that are currently scheduled through the municipal year. So the next one will be on Tuesday, the 3rd of December at 6:30. I'm guessing it will be in here. And the next one after that will be Wednesday, the 26th of February, again at 6:30 in here. And based on last year, there is always the possibility of an extraordinary meeting. So there's always something that might come up. Right, moving on to item 6, which is the minutes of the last meetings. Now, due to various events, we had 2 extra ordinary meetings in January. And then having that then caused a gap in our agendas, in our timing for the rest of that municipal year. And then, of course, we had the general election. So it is actually 8 months since we had a last Health and Environment Policy Committee. So we have 2 minutes to confirm when they are a fair reflection of those minutes, of those meetings. I've not received any feedback from anyone on the committee, either last year's committee or this year's committee, challenging those minutes. Just looking around the table to see if we are willing to agree to those minutes. Getting nods over there. Agreed, thank you. Now moving on to item 7, which is public participation. So I think we have 3 members of the public, including one of whom is a visiting councillor, who wish to speak. You can either speak at this point and get your points over now before any of the major items, or you can choose to speak in front of the item that you most wish to speak to. I've spoken to Hazel Agumbar, who I believe wishes to speak just before the air quality item in the agenda. Councillor Ian Tate, I think you want to speak to one item. When would you like to speak? Before a particular item, or do you want to speak now? Right now, okay. Councillor Batho, when would you like to speak? Sorry? Okay, so we'll start with Mr. Tate, who can talk now, and then we'll call Councillor Batho soon after. So, Mr. Tate, I think you're going to have 3 minutes. You're very familiar with the process, so I'm sure you know all the expectations.
Thank you, Chair, for the opportunity to speak at this committee. You may recall that I addressed this committee back in January 2022 regarding electric powered taxis operating in the Winchester area. I raised the issue of the challenges for taxi drivers to switch to fully electric vehicles. In January 22, there was only one fully electric taxi operating in Winchester, and that was by John Boardman, and very regrettably, the position hasn't changed since then. One of the main barriers to entry is the lack of dedicated supercharging points at any of the well-used taxi ranks. Many of the taxis drivers come up from Southampton, so need to charge prior to their working day to be able to operate effectively. Although there are charging points in the Guildhall yard, John has asked licensing, and those are not available even for taxis, so unused during the course of the day, but there we are. Following that meeting back in 22 and subsequent exchanges with you, Chair, we got close to having a meeting with the Cabinet Member for Place and Local Plan, but for whatever reason, they weren't available and the meeting was never rescheduled. The issue of electric taxis is covered in the electric vehicle charging infrastructure study for the Winchester City Centre and District, published in October 18. Although there has been a significant increase in the number of EV charging points, none of them cater exclusively for taxis. You may have read that report, but the report said there should be 2 supercharging points. It was a 5-year strategy which has now expired. They never occurred. With around, I think, 500 different taxis operating in the Winchester area, if they replicated the national penetration of EVs, there should be at least 20 all-electric taxi vehicles. There is just one. Taxis, which average about 27,000 miles a year, most of those miles are in Winchester city centre, so they constitute a high proportion of taxis. What is the purpose of the electric EV charging strategy? When the Super Hub came to committee, Councillor Lerney did turn up at the last moment, but there were no representations on file before the meeting. The officer referred to the strategy document in her recommendation to refuse the strategy. So how can this authority be committed to switching to an environmentally friendly form of transport without that core policy document? It's counterproductive. So I don't want to be mean here, but I feel that the council, this administration, is following rather than leading, and that is very, very regrettable. As a pedestrian, I breathe in all the fumes on the Romsey Road, which you will refer to later on in the air quality paper. They're in my lungs. Thank you very much, Chair.
Thank you, Mr. Tate. You always speak with passion about the subjects that you bring up. I think you've raised a whole lot of issues in there. We're here primarily to talk about policy. I think a lot of your concerns actually relate more to the translation of policy into implementation, and perhaps a viewpoint on how a particular issue was or wasn't handled. I know we had very passionate conversation up on the top of High Street when you collared me one day. So I got the sense that you were upset about that, and I have relayed that information to the appropriate portfolio holder. I don't think this is a forum to try and deal with the specifics of that issue, but I think the point you're making there is that there might be a need for taxi drivers to have a particular place that they can go to where they know it will be the only other competition for that electric charging would be other taxi drivers rather than the general public who might have parked there overnight and be occupying the space even though they finished charging. So I think that's the point you're trying to make, and that sounds reasonable. I'm sure we'll take it on board in one or more of the papers that are coming up. I might also suggest it might be a useful thing to bring up in an appropriate licensing regulation meeting where they're considering the whole taxi licensing subject. So if you want another avenue to try and pursue it, that might be a place to go. But I'll leave the portfolio holder to advise you on that. Right, thank you. Right, now I think as Mrs. Abdul-Bar is going to hold her fire until a bit later. I'm going to call Councillor Batho, if you'd like to come up to the lectern.
Thank you, Chair. Good evening. My name is James Batho, a councillor for St Barnabas in the north of Winchester. Thank you for the opportunity to address the Health and Environment Policy Committee and remind members of two motions, which are health related, that I've submitted to full council in the last 18 months. The first proposed reductions of speed limits to 20 miles an hour and were debated on the 18th of January 2023 and asked that the council express its support for the 20 to Plenty campaign, calls on Hampshire County Council to implement a 20-mile-an-hour limit throughout Winchester District, supports parish councils who want 20-mile-an-hour zones, extends a 20-mile-an-hour area in Winchester City as part of a wider programme to support active travel, requests Hampshire County Council to make 20-mile-an-hour speed limit the default in the county in streets where people live, work, shop, play and learn, leaving a 30 limit as an exception on roads where consideration of the needs of vulnerable road users demands a higher limit. And the leader writes to our county councillors, the members of the 20-mile-an-hour scrutiny panel, which has now concluded, and the Cabinet Member for Transport and the Environment to support this change. The second, regarding vaping products, was debated on the 30th of November 2023, and the Council resolved to support the Local Government Association call for a ban on the sale and manufacture of disposable vapes by 2024, and that disposable vaping products be regulated through the Environmental Protection Act in a similar way as other single-use items such as bans on plastic straws. That the leader write to the Secretary of State for Health and Social Care to express Council support for the banning of the disposable vaping products, and that Council should respond to any future consultation on the banning of the sale and manufacture of disposable vaping products by supporting such a ban. Both of these motions were passed by Council at the respective meetings. I'd like to return to that first motion and actually talk about some of the wider aspects that might be considered by this committee, and refer members to a Hampshire County Council plan, the Local Transport Plan 4, LTP4, that was published earlier this year in February. The plan explains how transport contributes to the Hampshire County Council vision to achieve better outcomes for the economy, environment and society. It identifies challenge and seeks to develop a transport system that supports a vibrant economy, is safe and healthy to use, does not pollute our environment with poor air quality and noise, and allows us to live healthier and more empowering lives. The plan identified 8 outcomes under 4 themes. The relevant theme for this committee is enabling healthy, happy, inclusive lives. And key outcomes to this are to have a network that supports and enables active travel and active lifestyle to improve our health and well-being. So success for this theme would be more travel, more journeys undertaken by active modes, walking and cycling by those who are able to, streets that are busy with people rather than cars, and increased levels of individual physical activity, i.e. more people travelling actively more frequently, which would result in improved levels of physical and mental health. So there is a connection between health and what we do with our transport system. And I'm asking that, as the plan concluded, that one of the core policies was actually putting people and places at the heart of our decisions, which I think is part of this committee's considerations. That core policy, C1, is balanced, or is backed by the fact that we want to shift away from planning for vehicles to planning for people and planning for places. Transport networks that simply aim to provide the most efficient means of moving private vehicles along a corridor have the potential to have a wide range of damaging consequences, particularly socially and environmentally. So to achieve this, the plan looks to prioritise the needs of walking and cycling, public transport users and delivery vehicles in accordance with the specific function and the types of location. It also suggests the use of a healthy streets approach. And that healthy streets approach has been used worldwide, firstly in London, but now in other locations like Sydney, to actually create a human-centred framework for embedding public health in transport, public realm and planning. The 10 healthy streets indicators focus on the human experience needed on all streets everywhere for everyone. So I'm asking the committee to consider including input from this healthy streets approach in the healthy spaces dimension of the assessment of the council's health priorities. Thank you very much.
Thank you, Councillor Batho. I'm sure all members here will have listened carefully and they will incorporate some of those ideas. I actually wanted, you've gone from the lectern, wanted to ask you a question. Your reference was to the 20-mile-an-hour motion zone. Obviously, there's all the general principles, which I think are very relevant into some of the health priorities and possibly far beyond that in terms of the council plan as a whole, because various aspects like planning are not necessarily figuring in the health priorities. But with respect to that motion of 20-mile-an-hour zones, is there a specific place in the health priorities analysis or the priorities that were set out in that paper that you particularly would like to see us think about and consider making a case for?
I think in terms of reading the paper, the area would be sort of the community aspect. I think some of the figures that are reported in terms of the number of accidents and indeed I think deaths are Winchester one of the top within the Hampshire district, the Hampshire County Council area. So I think one of the things that from a health point of view we want to do is to encourage people to walk and cycle and to use the streets for that ability to move around. But they are inhibited from doing that by the volume and the speed of traffic and the proximity of that traffic in many cases to the actual pavements. And therefore the motion to reduce the speed on a general basis to 20 miles an hour, where people come in contact with vehicles, is to actually encourage and to create that area of safety. And that's where the model, the healthy streets, actually takes that idea and actually gives a broader spectrum of ideas that can be done to encourage that view of the streets as somewhere that is safe to be able to do those things, because the benefit of that actually, and that comes back to the point of this committee and the considerations you have in front of you, is to do with health. So I think what I'm asking is that we actually break down the silo, which is people look at road safety and then health. Actually, road safety and the ability of people to walk and cycle in that same space that we have motor vehicles actually will contribute to the overall health of our communities, and will actually then support some of the priorities and some of the policy that we as a council want to pursue.
Okay, thank you very much, Councillor Batho. And I think when you said we are top in that league, it's top in a bad way, not in a good way. When you said we were top in terms of accidents and so on, that's not in a good way.
Indeed not.
That's
No.
in a bad way.
No, so that's why I'm reflecting some of the information in the actual report itself, which identifies that, you know, road accidents, we are not doing very well, and therefore some of these aspects and some of these factors, many of which are already in policies that the council has through its Winchester Movement Strategy and the support for the LT, the sort of walking and cycling frameworks is there. Thank you.
Okay, all right, thank you. Thank you, Councillor Batho. I should have had my mic on then for the recording. Okay, how are you going to play this? Are you going to lead? You going to introduce the
So
paper?
Sue was going to introduce, and just want to introduce Mike Newman. He's from the Hampshire County Council. I think you're the head of the public health team or member of the public health team. There, it's obviously Hampshire County Council's joint strategic needs assessment that a lot of this data has come from. So he's here to explain the numbers for you all. Thank you, Councillor, for the introduction, and good evening, everybody. I am going to start with a short introduction and then hand over to Mike for some of the detail on the data. But just to say that this is obviously a complex and interlinked sort of topic, and we have only skimmed the surface, if you like, in this presentation of some of the information that's available, and so there will be more that we can provide if there's particular questions that come out or other priorities get identified. But essentially what we wanted to do was provide you with a briefing around the context in which we operate. So not just ourselves as council, but how we work with our agencies, institutions and stakeholders. We'll look at the high level data so that we can understand our performance, and that will then lead us to looking at what we propose as the health priorities and test them against existing strategies and policies and plans that are already in place and might be emerging. And I think importantly to map it against the work of the council, and I think we've touched on that a little bit already, in the fact that the many of the activities of the council generate health benefits indirectly, some directly, some indirectly. And so what we want to, as an outcome from the session, is some clear health priorities for the district, and also to understand the council's role in how we support, enable and facilitate and improve those priorities. Just to chip in there, it's about the council being more strategic about where we're putting our resources and priorities, and identifying the right place for the impacts that we can have, making sure that it is having the best bang for the buck, that we are making the most of what we have available to us, albeit slightly more limited than other organisations may have. And we are genuinely seeking the views of this committee and feeding into what those priorities should be. Thank you. And here are the range of the other players and actors in this in a sort of field of work. And I think, you know, you've had the presentation, so you can see the level of activity that is undertaken by a range of partners across the district. So to the council's role then, I think we have highlighted two key areas that we are active in. One is about influencing the provision of health infrastructure and services, and we do that through our engagements, working in partnership with those agencies that we've shown on the previous slide, how we might fund organisations to deliver services, say through our community and voluntary sector grants, and how we work with local partnerships as well on some of the key specific areas of interest and topics that they are leading on themselves. And then we do then obviously have a more direct role, which is around delivering and investing in services and projects ourselves, such as our sports facilities, housing, open space, arts. And I think the themes there that we've highlighted will track through into some of the areas that we consider under the priorities and under the data. So I'm going to hand over now to Mike Newman, who is going to take us through some of the data and some of that information about performance. And I'll hand over. Thank you.
Thank you, Susan, and delighted to be here at the Health and Wellbeing Priorities briefing to support this agenda item. So I'm going to spend the next few minutes just providing a summary of key points from the Winchester from the Hampshire Joint Strategic Needs Assessment. So the JSNA produced by Hampshire Public Health. So, sorry, could I have the next slide? Sorry. Yeah. Provides a look at the current and future health and wellbeing inequalities of our Hampshire population, and that can be used to inform and guide the identification of health priorities within each local authority area. So the JSNA is really provided there to provide a mix of interactive tools and a summary of documents that uses a range of data sources collected across 3 dimensions. So that's healthy people, healthy lives, and healthy places. So the slide that you can see now provides examples of the factors examined under each of those themes. So you can see healthy lives on the left there includes a focus on risk factors for adults and children and touches on those building blocks for health. So around education, employment, access to financial resources, along with some of the modifiable risk factors for health, such as alcohol, smoking, weight, and physical activity. And then healthy people brings a focus on physical and mental health, whilst healthy places focuses on the wider environment, so highlighting areas which can impact our health and well-being. Next slide, please. Okay, so this slide provides a population and place summary. Again, I imagine that you're very familiar with lots of this information already, which can help contextualise the wider data and includes information on population structure, population density and deprivation. So the data shown is taken from 2021. So the population of Winchester at that time was around 127,000, and just over 1/5 of the population, it was over 65, which is slightly lower than the Hampshire average of around 22.6, but higher than England and Wales. And you can see by the distribution of age on the top left graph there, the population structure of the district. So if we move around to where perhaps older members, so older people aged 65 are actually more prevalent in different areas, we can see that we tend to find higher numbers of older people aged 65 and over living in the more rural areas of the district, so especially around Alresford, Bishop's Waltham and Molivers Battery. So we know that overall Winchester district has a high level of affluence, although there are pockets of deprivation, so within areas of Winchester city, so thinking about Stanmore and Winnall. And those areas that they show higher rates of deprivation overall, but they also show higher rates of deprivation affecting children and older people specifically. Thinking about population density, we know that obviously that Winchester really reflects that mix of urban city and more rural areas. So it has about 192.8 people per square kilometre, and that's about half of, well, just under half of the population density of Hampshire. So we see it's about 40% of the district population lived in areas such as the urban and city, and then about a third each roughly in rural town and fringe and more rural villages. Okay, and just a final note on anchor institutions. Susan touched on it earlier in the presentation, but obviously acknowledging that Winchester is home to a range of large public sector employers. So actually you're thinking about there's lots of opportunities there to the strength of those organisations to work in partnership around health and wellbeing. So if we turn to healthy people, the next 3 slides you'll see on the left is a broad overview of the areas the report focuses on. And then in the table to your right, there's a summary of key points in areas where Winchester performs well compared to local and national indicators, along with potential areas of focus for the district. So we know that life expectancy for males and females is better than Hampshire and England. But interestingly, Winchester City Centre is also the area in the district with lower life expectancy for both males and females, reflecting some of those differences in terms of deprivation. Thinking about multimorbidity, around 12.3% of the population in the district have 2 or more conditions, and that's lower than Hampshire as a whole. In terms of areas of focus, we know that Winchester has an ageing population, and if we look at population growth between now and 2029, the growth is predicted to be largest in the 85 plus cohort. So thinking about our kind of more at-risk populations in terms of our health inclusion groups. So Winchester District has a highest percentage of the population identified as Gypsy, Roma or Irish traveller. So whilst that's a relatively small proportion, it's still a high population in terms of the distribution of that group across Hampshire, and it has a high proportion of Roma and Irish traveller populations aged 24 or younger, so around 45%. So Winchester is also the district where veterans are more likely to report that their life is limited a lot by their disability than those in the general population. And I think it's worth noting that the proportion of people in Winchester who are classed as disabled is lower than the Hampshire average, but there are pockets of higher need in Winchester City. So thinking about Winnall, Stanmore and Airstock. Winchester also has a high number of people reporting a high anxiety than Hampshire. So that's the 3rd largest in the county. Next slide, please. So this is just more of an insight into the kind of type of data that's on the GSNA dashboard. So it's multiple conditions data. So you can see the proportion of people with 2 or more conditions on the left, and that generally tends to increase with age, obviously. And we have higher numbers of people in places such as Durley and Curdridge, Bishop's Waltham, South Central, and Denmead and Anmore. And just to note that the largest preventable cause of preventable mortality in Winchester is cancer, followed by, so most commonly lung cancer, followed by heart disease. Next slide, please. So in terms of healthy lives, Winchester compares better than England for the majority of indicators, including rates for smoking, alcohol-related mortality and child mortality. In terms of physical activity, so Winchester has a higher percentage of physically active adults and also has higher rates of walking and cycling. And that's higher than England and Hampshire as well. In terms of areas for focus then, there are higher rates. So local health data shows that there's higher rates of emergency admissions to hospital for injuries related to children and young people and the national. And that's for both children and young people under 15 and those aged 15 to 24. And those admissions tend to include things like injuries and poisoning, transport accidents and intentional self-harm. Next slide, please. So this data, again, like the last few, don't provide some wider context in relation to some of the healthy lives indicators. So, for example, in the top right, the light blue line, looking at the proportion of 5 a day, shows obviously Winchester performing well compared to Hampshire and England. And then if we look at the top left slide, percentage of children in low income households, we see that Winchester has a lower proportion compared to Hampshire and England and is the lowest of any Hampshire district. Next slide, please. So in terms of healthy places and areas that are performing well, we know that there's a high rate of access to public sports facilities. And Winchester has also a lower rate of overcrowded homes than in Hampshire. And most residents say that their community that they live in is safe. This places Winchester in the middle of the Hampshire district, so slightly higher than England and Wales. And also to note that the proportion of homes with a private garden, however, is lower than any other Hampshire district. So access to accessible green space is important, really important for residents, and Winchester compares favourably for this when you compare it to other district indicators. So in terms of potential areas of focus, older people aged 65 and over who show the greatest risk of being socially isolated live in a number of areas across Hampshire, so including Winchester City Centre, Stanmore, Alresford, Bishop's Waltham and Denmead. So there are also areas where they're less likely to use the internet for social connections. So rather than only for shopping, and they may be restrained by poorer internet infrastructure. As I'm sure you're aware already, Winchester is one of the most expensive places to live in Hampshire and is becoming less affordable. There are a smaller proportion of properties available for social rent and private rent than England. Next slide, please. Oh, sorry, go back, sorry, I've jumped the gun there.
Okay.
So in terms of fuel poverty, we show that there's a slightly higher proportion of households living in fuel poverty, so 9.1% compared to Hampshire, and in more of the rural areas. And that particularly shows to the east of the district around Brandine, but also in Stanmore. In Winchester, there are small pockets that are greater risk of food insecurity, and that tends to be Stanmore and Windmill, Springvale, Alresford, Bishop's Waltham and Wickham. And the number of road accidents, as was mentioned previously, is also significantly high, and we tend to see a higher proportion of casualties in fatal and severe accidents were males, and that trend is also kind of reflected in Winchester, as with accidents across Hampshire, and that occurs more frequently during rush hour periods in the morning and evening. Air pollution in Winchester, so thinking about that wider environment, is worst in the south of the district, so around Whiteley area. However, there'll be also pockets of poor air quality within urban areas of Winchester City. Next slide, please. So this is a final slide, really, just providing a summary. So I think overall, Winchester, it just shows is an affluent area with good access to urban green space, lower levels of crime than Hampshire overall, and has a large number of public sector employees in the area, which increases commuter numbers into the area. However, it also has higher house prices and a smaller number of properties available for social and private renting. There are pockets of deprivation within Winchester, mainly in Windmill and Stanmore within Winchester City, which experience higher rates of crime, higher food insecurity, fuel poverty and social isolation. And the more rural areas of the district tend to be home to a higher proportion of the population aged 65 and over, and those areas also had slightly poorer internet infrastructure. Towards the south of the district by Southwark and Wickham, there was an area of younger households with slightly higher deprivation, greater food insecurity, fuel poverty and exposure to poorer quality air. And finally, the table on your right provides that summary at a glance, so you can see a summary of different themes and then areas most at risk and areas least at risk. Thank you very much. I'll hand back to Susan.
Thank you very much for that overview of the data. And as I mentioned at the beginning, there's a whole resource all around the joint strategic needs assessments that's available on the county council website. It's an interactive tool. You can do mapping and change the criteria that you're looking at. So it's a very useful tool if you wanted to do further research on a number of those topics.
I think just to note for individuals as well, on the healthy places section, there's a whole report which summarises a lot of that in much more detail. So again, for those of you that are looking perhaps for more of a summary for healthy places, that's also a good place to look.
Yeah, thank you. It's important that our policies and our priorities are driven by the evidence and we're led by that, but we also need to consider the other factors and that could be also considering what role the council can play to look at the health outcomes of our residents and what factors we have control over, either directly or indirectly, and so that then we can identify the key health related factors that we should be focusing on. And I think the data has shown that there's clearly macro things at play here, but also very local issues as well. So I think that's a dimension that we need to bear in mind. So we have taken that data and we have done an assessment of what we consider to be the things that we need to focus on under each of those themes, and then giving it a review of how able are the council to affect that in those different roles of influencing or enabling, etc. And the spider diagrams here are trying to show where those factors match and meet, and then that has led to the conclusion of what we're proposing are the health priorities, which are shown in each of those boxes under each of the themes from the strategy.
And just to leap in there, we really value all of your opinions on these priorities. This was a tabletop exercise, as Sue has said, of me and the officers sitting around looking at the data and coming up with these spider diagrams. So any additional input is very, very valued here in particular.
Thank you. And that has led to what we're proposing this evening, which is the health priorities. But I think it's also important that the health priorities, that we set the aims of what we're trying to achieve for our positive outcomes for our residents and our places. And so there is the proposal that we look to sustain our good performance, address improve performance, with the aim of reducing health inequalities between people and places, and that we will continue to support and deliver activity that helps address and mitigate the factors that contribute to ill health and poor well-being in terms of place. So I think it's important that we have aims as well as priorities, so we understand what we're trying to achieve. So I said at the beginning that we wanted to test and check the proposals against some of the existing policies and strategies that are in place. The slide here shows that when we've tested that against the Hampshire and Isle of Wight integrated care strategy, and the blobs trying to demonstrate where we think there has been a match. And I think it's reassuring to see that our priorities are aligning with those of our strategic partners. And that's a similar picture when we look at the Hampshire County Council's Public Health Strategy 23 to 26, and the bolden text is again those areas where we feel we've got alignment with our proposed priorities and aims and those of our strategic partner at the County Council. And clearly they state, along with us, that the district and the councils have a role to play with our community and voluntary sector as well in influencing those factors. And then the other thing that we said that we would do is just actually map those priorities against our council plan. This is the current council plan, and I feel that there is a close alignment. Perhaps the one thing that isn't coming across strongly enough is that health benefit that other areas of work actually bring, that we're not perhaps expressing that there are many things to be gained from our work across the council that can help to contribute towards improved health priorities and a positive well-being in communities. So I think that might be another dimension that we may want to consider. So the next few slides are a bringing together of the proposed aim, the council plan, the health priorities, and a highlight of the work of the council against those, so we can see a little bit of a mapping. I fully acknowledge that this is not going to be exhaustive, and there are going to be very many other projects, services and activities that the council do that I've not been able to capture here, but I think it definitely demonstrates that already the council is doing a huge amount that contributes to that wellbeing and health priorities. And similarly for place, I think this is probably an area where we have a great deal of influence and ability to support the sort of communities and places where people live. And there are a number of health priorities there as well. So I think there is, again, a good number of activities there that show that we are already addressing and looking at those areas of the priority. So I feel that at this stage, whilst we want to be clear about what the priorities are and what our aims are, that we're not actually advocating for a whole new programme of work at this stage, because we already have a comprehensive set of activity that the council is undertaking. So purpose for bringing all this together and articulating what our priorities and aims are is so that we can very much demonstrate and communicate and target our activities for our communities, and that could be bidding for money, it could be giving out money, it could be making sure that all of our council colleagues understand the benefits that they are bringing with their activities. And to conclude, the next steps are to test this against the residents survey. Again, we need other areas of view and point and opinion to test these out. We want to align with and contribute to the Hampshire Health and Wellbeing Strategy Review. If and when appropriate, we can have these approved through a member decision day, and really hope that they will inform and update the council plan, which I know is a consideration later on in the agenda. So thank you, Chairman. That concludes my presentation. Well, our presentation. Thank you.
Thank you, Mrs. Robbins and Mike and Kathleen for covering a lot of territory in that session there. I have a hunch we could take 2 to 3 hours covering all the different dimensions of this, and probably then also have to think we need to come back and talk more. But we don't have that luxury. The way I look at this is there's a lot of information up front, heavily loaded. Members will ask questions on whatever bit interests them, but there might be some questions that we have about that, but the background GISD and information, the fact base, if you like, that I think might be a start. And then I think there's another bit which I would say just starts with what I call the spider diagrams, where I think we might want to have a look at that and sort of form a view as to whether we agree, disagree with the assessments of the 2 dimensions of that spider diagram. But being conscious of time, we're going to have to try and manage our way through that. So I'm going to open the floor. If we can start, I think, initially with questions around the fact base. I'll invite people to, I've got 2, Councillor Lee and Councillor Bolton. Anybody else? Could you just take a note of these? We'll try and do it in order. So I think Councillor Bolton was actually first. I'm going to give Councillor Bolton, and then Councillor Lee, and then Councillor Power, and then Adrian will keep an eye on.
I'm getting better, Danny, so watch out that finger. Thank you, Chair. Kathleen, fascinating area, undoubtedly, and complex beyond belief. So looking at the sort of, almost trying to stand back a little bit from it and looking at that JSNA data and stuff, my first sort of thought is it feels like there's a lot of qualitative data, but not a lot of quantitative in terms of causality. So there's correlation, but I'm not getting a clear understanding of causality. And for me, the then distillation of the information to what do you do about it requires an understanding of causality. And so that's my first sort of thought on that. And maybe I should pause a minute. If you'll forgive me, I'd like to just come back with a couple of other bits, or do you want me to just sort of blur? Fair enough, I'll do that. Yes, indeed. Yeah, I'll speed up then. So then if we go back to the slide that lays out the JSNA dimensions and associated factors, there were some things on there that were sort of, I felt, missing. And maybe you'll tell me that no, it's in there, but it's, it's just the way it is. One was on healthy lives, risk factors for children being access to good quality food. And then under healthy people, MSK waiting lists are the root cause of a lot of, adult morbidity leading to mental health issues, leading to lack of mobility, and overweight. And it wasn't sort of, I didn't know whether that was, it's being picked up in there, but in different silos. But I just thought I'd mention that. And I've really, I think that's probably the main overall. Oh, and then when it comes to the health priorities and assessments, I felt that there was diet and weight, if it's not already sort of showing to be one of the greatest influences on overall health, I think it will. And we've shown it as a 4 on the on that cost of living, on the health priorities, and that our ability to influence it is a 3. My feeling was that it's probably higher than that in terms of its importance, and our ability to influence is much lower. I don't know how we influence that. And so my question was more about how were those decisions made about what is important and what the level of influence we have. So that's I better shut up and let you.
Thank you, Councillor Bolton. Who'd like to take? I think there was several questions wrapped up in there.
I mean, I'm happy to take some of the questions related to the data initially and hand over.
And without wishing to cut you short, just be aware of time, because I know we've got a queue of questions, so you're going to have plenty of opportunity.
Yeah, I mean, just to try and briefly summarise, I think recognising the JSNA is very comprehensive, but like anything, it's about available data, and there will be areas where there won't be, and data's not the fail-safe, but there will be other factors that play into it. There is a mix of quantifiable as well as qualitative. So some of the indicators we talked about are self-reported data, particularly around things like well-being, but there's a range of wider information that comes into that, such as hospital admission data, for example. Road injury statistics. So there is a range of, I would say, a mix of that data. And in terms of the data itself, there is a full link to the types of data that are in there, but it's a broad mix, I would say. In terms of causality, I think that's obviously a very complex picture. I think what we're trying to show is the health need. What we know is that obviously in terms of health, there'll be many factors that play into that. We know with an aging population as well, we know that there'll be certain elements of conditions which will develop with age, and there's also a series of preventable risk factors related to things like smoking and alcohol and physical activity, which contribute to that. I think we also know, obviously, that in terms of health, that's socially patterned as well. So if we look at health outcomes and we look at things like areas of deprivation, we know that we have poorer, generally speaking at population level, we have poorer health outcomes in our more deprived communities and some of our at-risk populations. So I don't think so. I think what we've tried to do with that is kind of present the data to kind of identify a number of priorities or areas where perhaps Winchester colleagues can have a fuller discussion and help inform the priorities. So it's not meant to be, the only thing that you look at, obviously, when you're trying to do that and trying to consider it, but it is trying to provide a comprehensive overview to inform that kind of fact-based discussion. So sorry if that's not picked up every point, but hopefully that's answered the broad theme.
With respect to the spider diagram points that Councillor Bolton was, can I suggest we just come back to that in a little while when we perhaps have some other questions and we look at the spider diagrams more holistically, bearing in mind other members' comments. But if we could just, at this point, just, I think, focus on some of the fact base, and then we'll move on to the spider diagrams. So next we've got Councillor Lee.
Thank you, Chair. Thank you, Councillor Bolton. You captured quite succinctly some of the questions I was going to ask. I won't repeat those. I wanted to just pick up on causality, buildings, transport and location is what I wrote down. And then I looked at and heard what you said about high anxiety. I think the figure was 29%, which is extremely high. And then I looked at and heard you talk about demographics and the age factor, plus 65, growing to a high number to 85, digital deserts, lack of knowledge, and an aging population all wrapped into that. So quick question on the high anxiety bit. Do we know how much social prescribing the health authorities are doing? And I'm thinking about green space. And by the way, we talk about green space, but not blue space. And in the southwest of England and Devon, they prescribe blue space as a therapy as well, which is by water. So I think that's something we could actually factor in, because it does differ for certain people. I think that's quite important. Page 21, you talked about agencies. I didn't see any sort of indication of what I call rural or land-facing agencies, maybe the Countryside and Land Association, Business Association, whatever they call themselves these days. Have we talked to them? Is there something there? The farming community as well, and so on. Page 22, and I know it's later on in the slide, I think the community safety partnership is missing. And the reason I'm highlighting that, and I know Councillor Becker's heard me say this before, I think it's 2027, we're switching off the PSTN landline. And in the rural areas, there are poor mobile networks. And trying to get hold of blue light services is a real concern, a stress maker for those who are already anxious. So I think there's something there which I don't think you've picked up on, and I'm not sure what the answer is. And I have spoken to some of the officers about this. It's a tricky one. And then I think the digital hub, a bit like warm hubs, the social isolation, which comes out in your radar diagram later, maybe we can pick up on that. I think there's something there for the aging population. So I think the only other thing I wanted to say, and I think you said this, Ms. Robbins, on the other night at the Business and Economy, when there's a line there that says business as usual. I don't think we want business as usual. We need to be innovative within the limited budget that Councillor Becker has highlighted, because clearly there isn't a money tree out there, and I get it. So how do we integrate this fruit salad to get the best outcomes on the highest issues which are causing most pain and grief? And I think I'll leave it there. Thank you.
Thank you, Councillor Lee. I think there is a record for the duration of the question that has been asked in this room. I think it's currently held by a former councillor, Frank Pearson. So I think you're gunning for that record. Yeah, I think we might call that in a bad way. But anyway, folks, would you like to try and answer that question?
I think shall I just take the first point on anxiety, and then I'll defer to Susan for the other points that you make, Councillor. So I think in terms of that, I think in answer to your question, so that is a self-reported data around anxiety, and we know that obviously in terms of a number of factors, mental health, particularly anxiety, has been increasing across the population. I think in terms of the point around social prescribing, there is a range of, I think what we're seeing through the development of primary care networks, and particularly the kind of move to wider kind of neighbourhood teams, a real expansion in terms of the skill set in terms of the primary care network. So the availability of social prescribers is definitely increased, and I am aware that obviously there is a range of prescribing and referral to in terms of local support groups, but as you said, also things like green space and some of the things around 5 ways to wellbeing. So, you know, social connections, and I think the blue space, we didn't cover that there, but absolutely would completely agree with you in terms of the importance of that, in terms of its contribution to health and wellbeing.
I would just pick up the points about the agencies and the other partnerships that perhaps weren't listed. I think on page 21, this was very much about the health service and those sorts of agencies and institutions fully recognise that there are many other partners and networks that will address health as part of their area of interest or their service delivery. And then with regard to the community safety, again, we do mention that in the alignment of the council work with that community the safety and safe neighbourhoods priority that we're proposing. So it is recognised there rather than as a sort of a health partnership that we're engaging with, but fully understand that they have a key role to play in part of that health outcomes. And I think the business as usual, I think, as I mentioned in the presentation, this was about saying that we're not proposing a whole new programme of work, but I fully take the point that we should always be seeking for innovation, new ways of doing things better within the envelope of what we have. So I wouldn't want to give the feeling that business as usual means that we won't be thinking enterprisingly or in an innovative way.
Just going to jump in there as well. We, in respect of the social prescribing, our social inclusion partnership does include the social prescribers as well. So they are part of the conversation that the wider council has with the community, both within the city and within the district. So that is absolutely part of that conversation. The digital access is also something that we address through our social inclusion partnership. That's a specific project team. There we run hubs trying to teach older people in particular how to use devices. Those are being run in the city in the first instance. We are looking to expand that throughout the district as we get used to finding what works and what doesn't work and having the right providers to give those sessions. So it is absolutely something that is acknowledged as a risk factor both to mental health, to physical health, and we are already trying to take steps to address that. And as for business as usual, that's why we're here. We haven't done this before because we want to get views and we want to do things differently and make sure that we are addressing the health needs of the community in the best way possible within the framework that we have and we exist.
Thank you, Councillor Becker. I'd like to move on to Councillor Power.
Thank you, Chairman. I have a range of questions. First of all, there's...
Power, I don't know how long each one's going to be.
I always do brevity, Chairman.
I know you do.
You don't get me rattling on. Always.
If you could limit them to 2, then the rest of us might.
Well, I'm afraid they're
and then you can come back in later.
If you stop talking, I would have got 3 in.
Thank you.
First of all, you mentioned care and nursing homes. I think it would be more useful if we talked about places rather than the quantity of nursing homes. And we also need, I think, to plot sheltered accommodation. This is a big factor when looking at social isolation, both in social housing and in open market housing. And of course, we've seen from the demographics predicted that we are going to have a very much ageing population. I'd like to see some plotting against that, because that of course affects our planning policy. There's no mention of the adequacy of pharmacies. They're very much in the news at the moment. And we are in fact landlord, I think, to several pharmacies, and we should be taking that into account. And I do have a question, which is about food insecurity. Is it just about money or is it about access to a range of foods?
Thank you. Brilliant.
Thank you. I think I'll take the points and note them about the terminology with regards to care and nursing places and the inclusion of sheltered housing. So take those points. Pharmacies, I'm afraid I don't have the information in hand to be able to answer that. Food insecurity?
I think the food insecurity point is more in relation to affordability. So thinking about the available income to eat well and to eat healthy and not go hungry.
Do you think, Chairman, that sometimes access to fresh fruit and vegetables is a factor? Many corner stores don't stock fresh produce, understandably. Thank you.
Yes, Councillor Power, I think you made 2 points that very much resonated with me. Firstly, the one about pharmacies. There is quite radical change happening in the distribution market of pharmaceuticals, and it's challenging a number of the outlets. Well, outlets, is that the right phrase? But the pharmacy places, and that is causing a fair amount of anxiety with the people who are dependent on that. So I think that's an excellent point, Councillor Bauer. And the food insecurity issue was brought up I think only last night, wasn't it, at council, where we were talking about the Bar End site and how there's a demand there for a community store which has the types of range of goods that are much broader than you get from a petrol station store. So good points. Councillor Latham.
Thank you, Chair. It should only be a quick one for me. It's just my understanding of the data. I'm looking at the Healthy Places summary page, and I was wondering, can you just explain to me quickly either the sort of definitions of or the data behind, and this sort of follows on a little bit from what Councillor Power was just saying, food insecurity versus fuel poverty versus deprivation versus income and benefits. Obviously, they all seem to be correlated to me, and with sort of income and affordability at the core. But if I'm looking at these places and trying to think of causes and cures, you know, what it'd be interesting to see the differences in what those what the underlying data or the underlying definitions are for those. So would you just be able to sort of explain those quickly to me? Thank you.
So unfortunately, I don't have that information at hand to kind of provide you probably with what I can do is I can take that away and share it. It is available in our JSNA. It's just I've got that right this minute to hand to be able to brief you factually on the range of data that is supplied by that. But more than happy to share that outside of this meeting.
Okay, I'll do the homework. Sorry.
Thank you. Councillor Arrow.
Thank you, and thanks for the presentation and all the information in it. I suppose my comment and then a question. My comment would be that nobody could argue with any of the things that are in that presentation at all. I mean, it's and this must be happening, is happening all across the country, just in slightly different proportions. So, you know, that we were slightly higher on anxiety. I don't know why, because Winchester's a nice place to live, and Winchester District is a nice place to live. But so in a way, you know, knowing, you know, that this is all reasonably obvious, and it's very helpful to have it down on one paper. But when it comes to what we're going to do about it, probably what we are already doing about it, I just wonder whether anybody, whether there's any sharing of information in local authorities about what works with, for instance, weight and diet, which is one of the things that we thought we wouldn't have much influence over. You know, what works, air quality, we're going to discuss, that's an obvious one, but you know, to know, I sometimes feel that, you know, local authorities sort of are slightly isolated from each other, and there must be other local authorities who are wrestling with exactly the same problems, just in slightly different amounts. And I'd just like to be reassured that we keep our eyes very open for things that actually work to improve some of these difficulties. Thank you.
Thank you. Yes, we certainly do meet with our colleagues, and one example is that I've been invited to meet with colleagues from a slightly wider area than just Hampshire, where we've been talking about the benefits of work and how that impacts on health. So yes, there'll be certain opportunities, and we would take them, of course, to meet with other practitioners, local authorities or other agencies to learn from their best practice and what they've found to be successful. So yes.
Councillor Burchell.
Actually, an extension onto Councillor Aaron's question, and also Councillor Bolton's point about the correlation versus causality. You know, you can see, although we do have pockets of deprivation, we're, you know, a very fortunate area. It's set in a very beautiful part of the world. And again, the questions are with this, the fact base in this is how do you kind of get the eggs out of this baked cake, as it were, to work out which interventions that we're making are actually making a dent or actually adding to the things. Are we spending money on things that we would have anyway as a function of our affluence and our, you know, very beautiful surroundings and our very many coffee shops and pizza restaurants, whatever it is that we happen to be blessed with in this place? How does one go about cutting that out? And is the process of looking at other councils and what they're doing a good way of doing that to work out if they're doing things, if you're doing things that they're not, where we're succeeding? Has that been observed in any way?
Correlation and causation is a difficult area to try and unpick. I think the purpose of the joint strategic needs assessment is actually to look at many different factors that can have an impact on people's health and well-being, and I think to draw a line specifically between any one of those is quite difficult. The whole point is it's usually a mix of things that are going to affect a person's health, and that can be quite personal. It could be geographically based, and we've touched on the things that might affect that. So I think trying to take that whole picture of all of the factors to try and see what is that we're doing well on, or might need areas of focus, is probably the best approach that we can adopt. It's very difficult to say one thing or a couple of things will affect a person or a place in a particular way. I think an H area, because of that, is quite different in its needs and also its ability to respond to that. Now, of course, we will learn from others and we will talk to see what else is happening, but sometimes it can be quite particular to our area, or the priority might be quite specific for us, but we will always seek to learn from best practice and what others are doing. And we've got that wide network to help us in that.
Just to add to that, that's why we need to see this data at both the macro level and the micro level, because if you look at Winchester town as a whole, it looks very affluent. If you then break down, you look at Winnell, you look at Stanmore, suddenly it doesn't look quite so affluent. So having those different levels of data is really important. That's why the JSNA is so helpful in that regard. So we're not just shouting, hey, look how healthy Winchester is, because we know, and it would be disingenuous for us to say, look how healthy Winchester is, when we know that we have areas of deep deprivation. So we need those different levels of data to look at.
Yes, good point. Thank you. I think we're kind of getting into a point where we might segue into having a look at the spider charts. We have gone over the 45 minutes, so as I suspected, we could easily spend 2 or 3 hours, but that's not a target. That's I will get my fingers wrapped if we go to 2 or 3 hours. So if we could just briefly look at the spider chart now. Councillor Bolton brought up a point earlier in relation to, diet and weight and where that fits in. How much influence could we have? I think Councillor Batho in his representations earlier talked about road safety and speed and so on, and I see that's on the spider chart. So there's a couple of talking points there, perhaps on diet and weight and road safety, that we perhaps might want to challenge. Do you want to talk to those points first, or do you want us to ask questions and then you can respond to those?
If I may, it might help to just break it down a little bit to help capture what's being asked of us. I'm happy to respond on the weight and the diet.
Okay, if you want to talk to the
Perhaps we do each diagram. So we do one discussion on healthy people, one discussion on healthy lives, one on healthy places, just so there is a little bit more structure to the discussion.
Okay. So healthy lives is the middle one, is it?
Yeah.
Okay, do you want to just start with the healthy lives then? And diet and weight was a specific question that Councillor Bolton raised. Councillor Bolton's got his hand up.
Could we maybe just address how these were decided upon, what the metrics are before we do that, because otherwise we just don't know what the background is to how it was decided, the importance level or the influence level. That would be really helpful.
So,
I mean, you're welcome to do that. I think it was in the paper, wasn't it? I think was talked about.
It was. I mean, I can answer it very quickly. There was no great science to this. It was us looking holistically as the council experts in this area, looking at what we are able to influence and how we felt this was important. So we didn't have key criteria that we assessed each against. It was more a gut feeling. And what was striking was that each of the individuals in the room independently came up with very similar numbers for each of these. So despite not having that strict ranking system, we did come up with very similar rankings. So it's not great. It's not a great scientific experiment. It is based on experience and knowledge, and that's why I said it would be really helpful to get your views on these, because they were our first attempt, and that's why we've come to this committee to get your experience as the Health and Environment Policy Committee on these. If I may just add that the actual indicators that are around the wheel are the ones from the joint needs assessment, so they sort of follow through that, and so that that's the reason that they're there, that we have taken the evidence that's been presented, and for each of those areas, that's why they're there.
Okay, I'm not sure where we've left that in terms of how we can help you with this, because
Sorry,
I think, as Councillor Becker has said, you've had a few people in a room, you formed an opinion. Potentially, everyone in this room could do the same exercise,
yes,
and you could create a massive scorecard, but we're not going to be able to do that in 10, 15 minutes. So how can we help you with this process?
so I don't think we need a number from each of you, but a general discussion, a general feeling as to how, you know, do you agree with these? Do you think we're way off the mark on some of them? If you do, let us know, and we can reassess. There is no magic to being a number 4 versus a number 3. It's where we are putting our emphasis and where we are going to be putting our focus where we can. On the question of diet and weight loss, there is impact that we have there. We have the leisure centres, so both Meadowside and the leisure centre at Bar End. So we do have influence in that area to encourage exercise, which leads hopefully to lower or healthier weights. We have health walks, which we are launching again in Winnell. So we do have levers that we pull in those areas. It's definitely not a zero. And for the influence, there are things that we are currently doing, and further things that we could do. But you're right, it's a really important issue. If I may just add on that one in particular, we perform very well on that indicator, and some of these are things that we want to make sure we continue to do well on. You know, we don't want to let the things that people are benefiting from slip. So I think that was there particularly because we do well, we have got the levers, and so we want to continue with that.
Councillor Brocey, did you want to jump in?
Yeah, looking at the Healthy People bullet points you have there, is inclusion of health groups, older people, mental health and well-being. I notice throughout this slide, older people are identified, obviously because of our aging population, as an important demographic to focus on. But almost what I'm not seeing specifically identified is, say, how younger people's inclusion and mental health is looked after. We have got a lot of students, but we also have that kind of complex age where kids are getting a bit too old for after school clubs, but yet not quite going into, say, the workplace. Also, the interventions and the priorities you seek to aim to work on in future are things like helping people remain healthy and live independently for longer, and also preventing ill health and long-term conditions, which, although not exclusively, are more likely to be for older people as well. It does seem like this whole slide has a little bit of a blind spot for, say, older teenagers, and whether or not that's because they're not as much at risk, or whether those risks are being perhaps neglected.
So again, I think that comes down to that not being identified as one of the categories from the JSNA. So we have, for these labels around each of the spider diagrams, they do come from the JSNA, and younger people weren't identified as a particular area within that, which is why you don't see them labelled specifically, but obviously their needs are included within those. So the mental health is a key issue for younger people, as is alcohol, drugs, smoking, again, a really key issue there. People learning disabilities, again, an issue there. So it is there, it's just not there as a specific category.
Okay, Councillor Lee.
I think my question was sort of answered. I was just looking at the last spider diagram. I think you said it came from the JNSA, coastal communities. So I was scratching my head about that, but I get it. But I just wondered if there's a bit more granularity required. I mean, we've talked about urban, we've talked about rural, and within each of those spheres are particular hotspots of deprivation or need. So I wonder whether there's something that needs to be done or pulled out from that.
To you?
I-
I'm not sure.
I think I'm taking notes on points being made
Okay.
as much as being able to answer questions at this
Yeah.
point. Thank you.
Fair point. I'm going to jump in now with a question. I particularly want to pick up a point that Councillor Batho raised earlier in relation to road safety. We've got an item on this right-hand spider diagram where it's identifying importance as high. So hopefully Councillor Batho is reassured that it's identified in here as high importance. It identifies ability to influence at about 3, which I would say compared with some of the others is quite high. I'm not so sure I would agree with that assessment. The City Council's ability to influence it can in some areas, but in many areas we are at the whim of the county council there, as opposed to the City Council. So might challenge that. I think just to talk to the spider diagram, I've used these before, I've seen them used before, and they're really, really useful, but they do take a lot of time to get the inputs from a lot of people, and it needs a kind of, you know, to get people together in a room and you reach a consensus rather than having an individual view. So I think these are things that if we are able to maintain them over time, I think we'll refine them and get better at how we collect the input. So I do think they're useful, but it's just with 25 odd criteria, it could take a lot of time to go through. I think there's someone else, is there? Adrian? Margot, Councillor Power, sorry.
Thank you, Chairman. I'm going straight to the specific, Chairman. I'm querying our ability to influence on cost of living, child poverty, and community safety and crime. I think they are too high.
That's the ability to influence. Where would you put them?
I'd put them at, well, on community safety and crime, I'd put it down as a 1, because there are things you can do to design out the possibility for crime by good planning. But certainly in the rural communities, we are completely dependent on the police, and they are too often not to be seen. On cost of living, I would have thought there are many factors involved, but I put it down at a 1. And on child poverty, which is very closely related to to the cost of living, I would likewise put it lower down at a 2.
Okay.
We are going to have to focus our resources, Chairman.
Yeah, in terms of our resources as a council or our resources here and now? That's rhetorical. Anyone else wish to comment on any of these diagrams? Councillor Lee.
Yeah, I was looking at air quality. It's my belief that the importance of that is even higher than we're suggesting here. And our ability to influence that, it's really a question of what do we want to do? The flip side of air quality is our climate change challenge. And the two go hand in hand. So I think there's actually a bit more we can do, given our programme and policies in this council. So I think the importance could be even higher, maybe a 4, 4.5, 5, and certainly our ability to influence may be close to that as well, in my view.
Any further comments on any dimension in the spider charts? Okay, I think we're done. We've sort of had questions and a little bit of debate. Does anyone else want to make any final comments on this paper before we wrap up? Councillor Power.
Where do we go next, Chairman? That's my question. Because we this has to be progressed, and I'd like to know when we're going to see conclusions, results, proposals, or indeed anything else.
Okay, I think that was a question rather than debate, but unless it was a rhetorical question, in which case it could be debate. Was it a question?
Yes, it is a question.
Okay, who's going to answer that?
I'm happy to. So the next step is the resident survey has recently closed, interviews finished, not last week, just the week before. So we don't have the results from that yet, but we will shortly. And once we have those, we will test those responses against, bring all the data together, have another look, see if what our residents have actually told us aligns with what the data tells us, because sometimes it does and sometimes it doesn't. So we need to test that a bit further. Obviously the council plan, we will be having a discussion later on today, but we will need to set the priorities in that council plan. So that will be a specific outcome from looking at these priorities tonight and the results of the resident survey. And then as we've got on the next steps, as these evolve, we will have a decision day to look at setting a suite of health priorities. So we've got something concrete, more concrete looking ahead. So we have goals to achieve, because without having something written down, I don't think we maintain focus as we always need to. So we'd really like to have something written. It also helps us seeking bids and things like that for funding, where we have clearly used the data, identified our priorities, and we've got something in mind that we want to achieve.
Thank you, Councillor Baker. Councillor Brophy, you just got one final question.
Yeah, apologies if this would have been better at the beginning when we were talking about the data, but it's a question about the equitable distribution of some of the assets that we have and some of the resources that we're distributing. So one of the success stories in this is the massively higher than average, national average sports facility access that we have, which is incredible. But the question is, do we ever benchmark whether those are well mapped to those areas of need? Or conversely, if we say expand the community or build housing in a particular area, do we make sure that when we develop those in our planning, that we're also going to give them the same resources?
So we are currently in the process of developing the new playing pitch strategy. That we have consultants on the case at the moment. They have just finished speaking to all the summer sports, and they will start speaking to the autumn and winter sports very shortly if they haven't already. So that exercise is part of that strategy, making sure we identify what we have in the district as well as where it is in the district, and then the next stage is comparing that to where the need is.
Okay. I was going to say we are now at 5 to 8.
Yeah.
We have well exceeded 45 minutes. Well, we'll judge whether it's an important point. I was going to say if there are any points of debate, but I don't want us to take half an hour over it. I think we need to get to the point quickly. We can take a few of those. I've got Councillor Lee who wants to question into a debate point.
Absolutely. I was just picking up on Councillor Brophy's comment and your response. And often the case is that we want to do the gold-plated approach in terms of sports facilities or a built environment. I recall doing many visits to Germany, for example, and the outdoor green gyms and so on. In the Meon Valley, I'm thinking of the Meon Valley Trail. Every now and we could have a stance every half a mile or something. This is cheaper than building a massive built, edifice of some sort. That's the point I want to make. There are other opportunities. Thank you.
Thank you. And just to note that we do have outdoor gyms throughout within the city. Not in the Meon Valley, no, not in the Meon Valley. It's difficult because we don't have the council-owned open space in the Meon Valley. That tends to be parish-owned outside of the town. But we do have those facilities, and those are included. We also have informal play spaces that we include in those sorts of assessments too.
Thank you. I think Councillor Bolton wanted to make a point of debate. Is that right?
Yes, thank you. Yeah. So I guess what I just wanted to say is that I think this is hugely commendable. We desperately need to do this type of work. I think that we need to build on this hugely, clearly. I think we need to be a bit clearer about some of the data and where we've got, just qualitative data, and when it's thin qualitative data, it's important that that comes out, that these are, sort of don't rely too much on some of this, and don't read too much into some of this, and build on that so that we get more robust understanding of the link between causation and, etc. So I think if really pushing forward and expanding some of these areas of work like that, the spider charts, and having way more sort of data inputs, I think would be really valuable. Some of the it goes on to sort of say some of the activities, just going back to that sort of healthy weight and diet point that we talked about earlier. Our activities are about supplying more of it where we can. Whereas I think the problem with food is the quality. And I think that, to Margot's point about fruit and veg, where we can get quality food into people is better than highly processed food into people, and get it to them as cheap as possible. Those are the things that I think make the biggest differences in health. But otherwise, I think a good place to start, and we need to really build on it and improve the data, and make good decisions, because we know we've got good data to back it up. Thank you.
Thank you, Councillor Bolton. Councillor Lee.
Sort of pick up on the point that Councillor Bolton raised, but I think it's very important. Developments of growing organic food in the outer regions of the district and getting them to the city appropriately. Obviously, there's the food box schemes, etc., etc. I just wonder if there's something there that might need a deeper dive. And I don't know whether the officers or Hampshire have looked at this. That supports the economy. It also would help a healthy outcome. And I just wonder if there's some work that we need to do.
Okay, not seeing any more hands go up for debate, so I'm going to try and wrap this one up. I think this is a really commendable, I don't want to say first attempt, but it's a first thing that's come to the head, that certainly in my time, where we've tried to pull this together. I think having a set of information, fact-based behind it, and then leading a process by which priorities are worked through is a really useful thing. It's a transparent process in that we can see what the attributes are, we can see how they've been scored in terms of importance and ability to influence. We might have disagreements about what the numbers should be, but that presents an opportunity in future to have a look at how we might get a more collective consensual opinion on what those scoring points, what those scores should be. And of course, you can always go into more granularity, but this is a policy committee, not into all the details for every single ward or every single micro ward that we all look after. So it's always going to be a bit high level. So I think it's a really good thing to do. And as I think Councillor Becker said, I think it provides a platform that can be referred to in lots of other things that the council does influence, that it provides something where we can refer back to and say, okay, what was said in that paper? So I think this is a really valuable thing to do, and I look forward to seeing the next update, perhaps in some tweaks to it based on process, differences in the process or whatever that we are looking through. So thank you very much, Mrs. Robbins, Newman, sorry, Kathleen, Becca, for bringing this to us. I did say we would have a break, quick comfort break at about 8. I was hoping we'd have got through 2 papers by then, but I think but we have to be ambitious. So I think we'll have a quick comfort break. It is now 5 past, so we'll make it 1/4 past. If everyone is round the table a bit earlier than 1/4 past, we will reconvene and get going then. Thank you.
Which one is it?
Right, we're going to move on to the next item in the agenda, which is air quality. But before we go into that next item, I'd like to call forward Hazel Agumbar, who is, I think, going to talk to us about some concerns she has about air quality in Winchester.
Thank you, Chair. Good evening. My name is Hazel Agumbar. I live in Hyde. I work for the Environment Centre in Southampton and deliver a wood burning engagement programme to 4 local authorities, including Winchester City Council. The project seeks to raise awareness of the health impacts of wood smoke. I'm here today as a resident, however. The draft air quality strategy states that air quality in Winchester is generally good and has improved over the past 5 years. This does not paint the whole picture, however. Many neighbourhoods throughout the district are air pollution hotspots due to the growing trend for log burners. Wood smoke is a Class 1 carcinogen. Along with toxic chemicals such as arsenic, it contains particulate matter, which are tiny bits of soot and dust, so small that when they are inhaled, they pass from the lungs into the bloodstream and circulate the body, causing inflammation and harm. Wood smoke is linked to an exacerbation of many diseases and increases the risk of cancers, heart disease, asthma and dementia. In the UK, wood smoke has now overtaken traffic as the greatest contributor of particulate matter air pollution. A very recent report from Imperial College shows that daily death rates in London increase when the air is filled with pollution from the burning of wood. Wood smoke pollution is literally shortening lives. I live in a street where there are at least 5 log burners in neighbouring properties. In recent years, during the heating season, I open my front door and I'm hit by the stench of wood smoke. At times I can smell that smoke inside our home. I close the vents, I tighten the windows, I block up the letterbox, but still the smoke finds its way in. Public awareness of this issue is very low. The stove industry, a remarkably under-regulated sector, has pushed the message that modern stoves are a greener and cheaper way of heating the home. They are not. Even a so-called eco stove is 450 times more polluting than a gas boiler. For the same amount of heat, wood burning produces more carbon dioxide than oil or gas. Cutting down trees for fuel is an ecological disaster in a climate crisis. At every outreach event that I attend for work, I talk to people who are deeply worried about the impacts of their neighbours' wood smoke on their family's health. These residents fear speaking out, so they're suffering in silence. I congratulate the Council on its ambitions to go above and beyond the UK national targets for air quality levels. We urgently need strong leadership to protect residents who suffer from wood smoke pollution and who are forced to breathe dirty air near and in their own homes. I urge all councillors and officers working on the implementation of the strategy to prioritise tackling wood burning. Wood smoke is the most potent and the most easily avoidable source of air pollution that blights so many parts of the Winchester district. Thank you.
Thank you. That was perfectly timed. Just one question for you. You've obviously seen the paper, I think. I think you commended the council on its ambition to go further than the targets. If those targets were being met, would that make you feel more comfortable? Or are you looking for total elimination of wood burning stoves?
Well, that's a really good question. Obviously, ideally, I would love a total ban, and many air quality campaigners, and in fact, doctors are calling for a total ban. At this stage, this is an unrealistic expectation, and it's a government thing that we don't have any influence over, perhaps. But any reduction in wood burning brings with it health gain. So I think anything the council can do to raise awareness of the health impacts, and we're doing that. The project that I work on with David is trying to do that, but I don't think it's getting enough priority within the council, and that's why I'm here today, to try and raise that awareness so that that can spill out into the message we're giving to the public.
Okay, thank you. well, you'll appreciate we can influence policy, and then there's having a policy, and then there's trying to achieve the policy objectives, separate things. I don't think we have the power to ban wood burning stoves, and I'm sure you know that. So I'm not sure. I don't think you were asking for that, but thought I'd just clarify it. Thank you. I was going to hand over to the officer, David Ingram, and cabinet members to introduce the paper, and we can take the points you've raised in the context of the paper. Is that okay, Councillor Porter?
With a short introduction, if that's okay. This is a paper that Councillor Lerney and I are both involved with. It's something that we are very closely aligned on, and it's really good to be here tonight. So Winchester City Council has been monitoring air quality for well over a decade. We're ambitious for better air quality for our residents in the district. It's a key part of our Living Well agenda. Air quality is monitored in Winchester and across the district. Outside Winchester, air quality is better than in Winchester itself, where we have an air quality management area called an AQMA. You'll hear more of this tonight from David. In the presentation, there are many acronyms, but for those that might not have been involved with these before, these are probably the most useful. An AQMA is our air quality management area. An AQAP is our air quality action plan. And our AQS is our air quality strategy. Don't get them mixed up, folks. They mean very different things. Your HEP work programme includes the annual review of the AQMA, detailed in the AQS. It's not normally, but it is this time. We've made good progress with PM10s, that's particles of 10 microns, and NO2, nitrogen dioxide, results below the government limits set. But the upside of Romsey Road is persistently just on the limit for NO2, and our AQMA will therefore continue with an AQAP for that road. I'll test you later. Winchester City Council is leading Hampshire in developing an air quality strategy for our whole district. Our officer, David Ingram, is a founder member of Clean Air South, hosted by the University of Southampton. David is our service lead for public protection. He'll take you through the air quality update in our AQS. This area of work, as I've mentioned, is led by Councillor Lerney as Cabinet Member for Climate Change and me as Cabinet Member for Place and the Local Plan. This draft AQS was commissioned following meetings of the cross-party steering group. The steering group includes Councillor Wallace and Councillor Bolton, thank you, and stakeholders from WINAC, the BID, and James Moore from the Directorate of Public Health Transport, and our expert AQ officer, Phil Tidridge, and our communications, relevant planning, carbon and transport officers. We agreed quite early in the process that we'd set ambitious but achievable targets for NO2 and PM2.5 by 2030. The particles generated by these pollutants, as Mr. Ross said, are dangerous to our health. We must reduce their impact, but we need to take the public along with us too. Air quality can be a complicated conversation, and the intention of the document is to present it in an accurate but lively way with clear illustrations that tell the story graphically too. We'd welcome your views on the air quality strategy document, which is currently out for consultation, and the steering committee will take those views into account.
Thank you, Councillor Porter. Handing over to Mr. Ingram.
Good evening, Chair. Good evening, members. As Councillor Porter kindly introduced me, thank you very much. It made me seem quite amazing, actually. Thank you. Yes, this is my update to you on our air quality situation as currently the case in Winchester, and I propose to go on to explain the process of adopting the air quality strategy and obviously a little bit about the strategy itself. So for some of you, I'm assuming that you are sort of relatively new to the subject of air quality, so I'm just going to try and put some context to our situation as it stands at the moment. From Winchester's perspective, we've had an air quality management area, live air quality management area since 2003, so it's certainly not a new development. And the air quality management area that we have today is the same air quality management area that as designated more than, well, 30 years ago, 20 plus years ago. So it's well embedded within Winchester City's area. There are various parameters that we had to try and, or traditionally had to try and monitor. The two that you need to focus on from the perspective of Winchester is nitrogen dioxide, and as Councillor Porter laid out, PM10s, and more recently we're now focusing on PM2.5s. However, there have been some relatively recent developments in the statutory framework in relation to clean air. So back in 2021, we saw the Royal Assent of the Environment Act, and this places a duty on the Secretary of State by regulation to set out long-term objectives and measurable targets in 4 priority areas of water, biodiversity, resource and efficiency, waste reduction, and of course air quality. And as part of that particular duty, the Secretary of State, as for the air quality agenda, set out PM2.5s, which are known otherwise as ultrafine or fine particulates. And there's an annual mean standard, which I'll come on to later. As part of that duty, the Secretary of State must also prepare an environmental improvement plan at least once every 15 years. And the primary objective for that is to significantly improve our natural environment. So there are quite strong expectations on central government as well as local government. And again, as part of that environmental improvement plan, government set 10 goals, of which goal 2 is to deal with the matter of clean air. So that puts the sort of national context. As part of that goal 2, there has now been an air quality strategy that the government has published under their wider duty. This amends the Environment Act 1995. So the Secretary of State has to publish that statement with respect to the assessment and management of the quality of air within 12 months of the Act. And that, as I say, is that little graphic there, which shows you that they have done that, and that must be reviewed every 5 years. So currently we're 2024, so we're already 2 years into that strategy. And the Secretary of State also has a duty to provide an annual progress report, a little bit like us, and I'll come on to that in a minute in terms of our annual status reports. So in terms of absolute levels, I won't dwell on this slide for too long because it's a bit busy, but I've highlighted in red the ones that are relevant to us in Winchester. Under the Air Quality Standards Regulations 2010, so we're looking at regulations that have been around for quite some time already. That set down nitrogen dioxide standards. So the short-term standard of 200 micrograms is detailed there, but we have been compliant with that standard now at Winchester for quite a few years. The annual mean nitrogen dioxide standard is 40 micrograms. And as Councillor Porter referred to, we are compliant in all areas of the Winchester district with that standard and across our current air quality management area, with the slight caveat of concern of Romsey Road, which I'll come on to in more detail later on in the presentation. But under the environmental targets fine particulates regs that came out last year, the government has adopted a new standard which relates to PM2.5s, and it's set an annual mean standard of 10 micrograms per meter cubed to be achieved by 2040. And on our road as a nation to achieving that standard, it's also set 2 interim standards, which is based upon 2018 levels for PM2.5s. We are expected to, as a country, so this is standards set for national government, to achieve a 22% reduction on 2018 levels by 2028, and then a 35% reduction on PM2 levels based on 2018 levels by 2040, which is the final standard as per those regulations at this time. I mean, clearly that's a long way into the future, and air quality standards may be reviewed and updated over the course of that period. So, as it were, for us, we've been very much focused as a local authority and across the local authorities up and down the country. The duty to monitor air quality sits with the districts, not with the county. And we've been very much focused on nitrogen dioxide and PM10s. But the new kid on the block is PM2.5s, which is, as I said earlier, ultrafine particulates. One of the reasons that the focus is being put onto the much ultrafine particulates is that there's a lot of recent evidence to support the position that it's actually getting to a submolecular level in the human body. So it's getting into cellular level. It's getting into neural tissue, deep into your lungs. So it's causing, as Hazel mentioned earlier, pulmonary problems, cardiovascular disease. And also there have been recent studies which have highlighted that people living in high polluting areas along busy roads, there are high levels of dementia in later years from PM2.5s. And in terms of the sources, I mean, it's a widespread pollutant, so it can travel long distances. Primary sources of burning, it's been identified that 20% of that is coming from domestic sources, including solid fuel burners, wood burners. Friction sources such as brake and tyre wear, so it's obviously transportation sources, obviously industrial, and more interestingly, agricultural sources. So as part of the government's national air quality strategy, they're placing an expectation on local authorities to engage in a dialogue with the agricultural sector, so our farming community, which is a new angle and direction that we're expected to explore. Because there are secondary pollutants from the use of ammonia and nitrates in agriculture. So there is a real dichotomy of a problem presented there, that actually the processes that we currently adopt to feed our nation through the use of ammonia and nitrates is also having a detrimental impact on our air quality. So it's a real difficult balance to find. And then there's regional and international sources. And because PM2.5, as I say, is a regional pollutant, it can carry long distances. We also have a bit of a footprint from our neighbouring authorities. So, for example, neighbouring or close by, for example, Southampton with the docks, with the cruise industry, all the cruise ships coming into Southampton, that's actually having a bit of an impact on our quality, our air quality in Winchester and surrounding districts. And internationally, obviously, we share our air globally, and it can travel long distances. So this new legislation, as I say, is setting out an air quality strategy at a national level. However, as part of that strategy, it also places expectations and actions on local authorities at a local level. And I'll quickly canter through these. It basically says the local authorities must have a regard to the national air quality strategy when exercising their functions. We are expected, as part of the national strategy, to support it and be proactive by improving air quality in our particular jurisdictions, whether we have an air quality management area or not. And that's quite a departure, because up until recently, local authorities that hadn't declared an air quality management area kind of sat back a bit, and air quality wasn't really on their agenda. They can't hide anymore. They still have to have an air quality strategy setting out how they are expected to improve air quality within their districts. Number 3 there is that air quality must be informed by monitoring assessments. So that's essentially saying, how do we know we're improving our air if we don't monitor it? Standard science. And when we're formulating our strategies, we are obligated to engage with the directors of public health in our area, for ourselves here at Hampshire County Council, which we have done. And it actually places a duty on them that they have to engage. Previously, it's like, yeah, you can talk to them, but there's no obligation on them to engage. I'm not saying that they didn't, but now it's been tightened up and they have to engage, as well as a new duty on air quality partners to cooperate with us when we're setting out our new air quality strategies by providing assistance. And by ways of example, those partners are the neighbouring local authorities, the Environment Agency, and critically National Highways. Okay, so they are now obligated to engage with us. They can't sort of not. Carrying on, we must support the central government on delivering of PM2.5 targets. The information that we put out to our public must be of high quality, easily understandable and accurate. We need to be seen to be exercising the powers that central government have given us to improve air quality. For example, exploring clean air zones, which we have done in Winchester, I have to say. But we are not London, we are not Birmingham, we haven't got the economies of scale that those cities have to put in things like ANPR networks to, you know, have clean air zones to charge people to come into our town centre. So there are macroeconomic drivers with regard to clean air zones. But smoke control areas, as Hazel presented earlier, solid fuel burning is a major contributor to particulates. And we do have smoke control powers that we can deliver at a local authority level. So as I'll come on to, our air quality strategy does go into that. And we need to have greater understanding of our industrial sources and take a robust but proportionate approach. Not quite so much of an issue at Winchester than it would be for, say, a major urban metropolitan area with lots of heavy industry. But notwithstanding, we do as a local environmental health department have various polluting processes that we do regulate. So we're already fulfilling that function. We need to include in our strategy transport planning. Big issue, obviously. We all know about the movement. Well, I assume we know about the movement strategy, which is one of our sort of strategic objectives in improving our transportation. And we've heard earlier from an earlier speaker about the need for sustainable travel, active travel, making it a lot easier for our local populations to engage in that instead of taking the easy option of jumping in the car every day. So we want to encourage that behavioural change. And as I mentioned earlier, we need to engage with agriculture to tackle ammonia emissions, planning strategies as well in terms of how we future develop our district with a view to not contributing any greater impacts to our air quality. And the new kid on the block as well, which has been included in the National Air Quality Strategy, is indoor air quality. We spend, I forget the statistic, but it's way more than half of our living life inside buildings as an average. I think it's something like more than 65%. I don't quote me on that, but it's a lot. So indoor air quality is now considered as part of our clean air strategy going forward, air quality strategies. But there is no prescribed format for an air quality strategy. There is for an air quality action plan. There's no prescribed format for an air quality strategy. We just have to demonstrate that we are supporting central government in its overall objective of improving air for everybody inside and outside our jurisdiction. And obviously, if all local authorities pull together, that will have a net positive benefit of air quality nationally. So we have to play our part. So that's the sort of very quick, well, maybe not so quick, but canter through on what our sort of duties and expectations are. But where are we currently in terms of our air quality in Winchester? So every year we have to produce an annual status report. And this year we submitted our status report back in, I think it was late April, early May. DEFRA, who received that report, reviews that annual status report, and they will either accept or reject its findings. And we have had all of our annual status reports accepted. But you sense there is a but coming, and we all hate that word, but there is a but coming. Apart from this last year, 2024 annual status report, but I'll come into that in a bit more detail. If anybody's interested in looking at that, that's on our webpage, so it's a public information document. The URL is there, but I don't know if you can actually get that off the website, but anyway, you can find it on our website. So the Air Quality Action Plan, as I mentioned earlier, seeks to control nitrogen dioxide inside the AQMA. We've undeclared on particulates back in 2015, so it focuses on nitrogen dioxide. We have 2 static air quality monitoring stations at St George's Street and Romsey Road that monitors nitrogen dioxide, and one of them monitors particulates, both PM2.5 and PM10s. We have 31 nitrogen dioxide tubes inside the city and 1 outside in Kingsworthy. And we have 1 low-cost analyzer in Twyford, which is there on temporary location. So the rural wider district routinely is consistent with current air quality levels as mandated, and has been for many years. So we don't tend to monitor as routine out in the wider districts, but that will change as part of our air quality strategy going forward. And the reason being is that the Air Quality Action Plan focuses on Winchester town centre. The strategy will be a district-wide strategy. So it includes not only the city, but all our market towns, in fact, our entire district, assuming we agree it has to go through a process. And as I say, we have been compliant with all air quality objectives, which is another acronym, AQOs, for the last 3 years and prior in many instances in all levels, except for an uphill section of Romsey Road. That is the fly in our ointment, ladies and gentlemen, I'm afraid to say. So this is the readings from Romsey Road. As I say, everywhere else is compliant, so I've just focused on this area. There are four monitoring locations essentially on Romsey Road. In fact, there are more, but I've pegged the highest ones here. And the graph shows you where they are. So opposite Clifton Road, uphill, actually one of those should say downhill, sorry, that's a typo. Opposite West End Terrace, Knights Hill, and you can see for yourself. Now the yellow hatch line is the annual mean standard. However, in order to be able to demonstrate compliance, there is a 10% confidence on our readings. So that means that we have to be below 36. Obviously 10% of 40 is 4, take off 4, you get 36. So the real number that we are interested in, even though the law says 40, but for us as officers and as a local authority, we need to demonstrate consistent compliance with 36 micrograms per metre cubed annual mean standard, because that's the standard against which we are currently monitoring. So we submitted our annual status report to DEFRA in May, and we received our response from DEFRA in late August, and they have not accepted our annual status report. But why is that? So when we submit our nitrogen dioxide tube data, these are little tubes that sit on lampposts, and they are passive monitors. They are low tech, and they are intended to give trended analysis. So as part of that low tech, there are various bits of science, which I won't go into in too much detail, but there are 3 correction factors that we use when interpreting nitrogen dioxide tube data. And these are annualization. So because Romsey Road, and I don't want to demonize any cohort of our community, and I won't say it in public office, but because it's on Romsey Road and we have, it's a heavily trafficked road, certain people in our community pinch the tubes. Thank you very much. So if we only get 9 months worth of data, imagine there's 1 tube per month, then we have to apply an annualization factor. Okay. We also have to distance correct the tubes. So the science behind this is it's all about public health. So the point of interest isn't necessarily the side of the road. It's the side, it's the point whereby the receptor is, i.e. the person, and the receptor in the science of air quality is the facade of a residential property. So we have to do a distance correction from where the tube is in relation to the highway and the distance to the facade of the nearest property. Okay, so that's distance corrected. And then finally, we have to do what is called a bias correction, which is to say, because these bits of tubes are low tech, we also locate a number of these tubes next to our 2 very much more higher tech, £27,000 worth of tech, pieces of equipment. So we put other tubes next to the much more detailed and what they call MCERT standard kit, and then we work out what the difference is. Okay, and then we take an annual average, and then we bias correct it to the other sites in Winchester's town centre. That's it in a nutshell. If you really want to know the more detail, Phil will be able to give you that. Even though we've applied a local bias correction for the last 10 years, for some reason this year DEFRA have decided that they want us to apply a national bias correction, which takes its data from their regional sites in the southeast of England and applies their national bias correction, or applies a bias correction which they've said we need to use on our annual status report for this year. This is very much a departure on the previous responses we've had from DEFRA, and guess what? If we apply our local bias correction, we come in under 36 micrograms. If we apply the national bias correction, we come in just a teeny little bit over 36, which has the significance of basically saying that we cannot now undeclare on our existing air quality management area. I am happy to say that Phil, who's a lot more technically knowledgeable than I, is currently in dialogue with DEFRA over that particular matter. So it's not a done deal yet, but we are looking to understand why they've adopted that approach this year. kind of run ahead on my slide, haven't I? So the bias correction locally was 0.77 and the national one was 0.83. So, and then if DEFRA rejects our position, then we will be compelled to review our current air QMA. So that's an interesting point. If DEFRA don't accept our rebuttal, then we will be obligated to keep our air quality management area, but we can review its size. So currently, our air quality management area is in the top left-hand side of the slide there. So that is the whole of Winchester Town Centre and 8 radial roads coming out of it. We in our little team call it the squash spider. That is our air QMA currently. If DEFRA do not accept our position by going for the local bias correction factor, then our air QMA, once we've been through the various different processes, will likely look like that linear stretch of road along Romsey Road, which is in the bottom right hand side of the slide. So that stretches basically from the top of the high street, just past the hospital on Romsey Road. Okay. And an air quality management plan runs for a 5-year term. So that's another piece of work that we will have to do, but we shall see. So we are in an interesting phase at the moment with air quality, as I say, because we are currently working on the air quality management area under the 1995 Act. But the 2021 Act, the new Environment Act, has, as I said earlier, set out the new air quality strategy expectations. We have, as Councillor Porter has mentioned in her introduction, we've been going full steam ahead with a degree of confidence that we would achieve the ability to undeclare on our air quality management area. And we now have an air quality strategy, which, as I say, has gone out to public consultation. So I won't go over what Councillor Porter says, but it's been subject to an air quality steering committee, cross-party committee, specialist officers and external stakeholders. And we have, as part of that strategy, been looking at the WHO, the World Health Organization air quality guidelines. And they set out a number of guidelines for PM2.5s, PM10s and nitrogen dioxide. Those are in blue. The 1, 2, 3 and 4 are levels or periods of time. It doesn't prescribe. It must be a date. And the reason being is because this is a global standard. So everybody's in a different place globally. But these are sort of targets, interim targets, until you reach the ultimate game of 10, 15 and 5. We have chosen to adopt, as part of our air quality strategy, nitrogen dioxide levels of 30 and a PM 2.5 standard of 10. Now the 30 is 10 micrograms below the national standard, and the PM 2.5 meets the national standard, but we expect to be able to deliver that 10 years before 2040, so by 2030. PM 2.5, we already meet the 30 standard, so we've pegged that as well. And one of the reasons why we haven't set a PM10 standard in the air quality strategy is because it's very much wrapped up in the PM 2.5. So in achieving 10 PM 2.5, we will also achieve a really high PM 10 standard. So onto the draft air quality strategy itself. It's a 5-year strategy, which currently out to consultation. The consultation lasts till the 27th of October. I will just mention that there is a members briefing on the 2nd of October. So if you want to know more about it, you can join that briefing. It sets out our aspirational standards. And as I've just mentioned, these are 30 by 30, so 30 micrograms to be achieved by 2030 and PM 2.5, 10 by 2030. These standards are believed to be deliverable. So there was a lot of conversation about whether or not we could deliver those standards by that date. There's no point in setting an unachievable standard. And we all agreed after much discussion that they were deliverable based upon the current levels. And there are essentially 5 themes in the strategy, which cover 13 different actions. And these 5 themes, as you can read on the slide, are the monitoring, transport, domestic heating, indoor air quality, and construction and new developments. So intended to cover all those 5 themes. And these are some of the infographics that we have within our strategy. The strategy was worked up with a consultant called Ricardo. They have a lot of experience of drafting strategies for other local authorities, even though it's fairly new as an expectation of local authorities. It's been around for about 18 months. So some of the larger authorities have gone full steam ahead. They've employed consultants to write their strategies, and Ricardo definitely came out as one of the favoured partners. And I like to think when you see the strategy, you'll understand why, because they are very much about creating a document that is public facing. There's a lot of science in air quality, there's a lot of things that confuse people, but ultimately the strategy is intended to be user friendly, easy to read, and there's a lot of infographics in it to make it understandable for everyone. So you've got the 30 by 30 graphic in the top there, on top left hand corner. You've got the vision set out there, which sets out our aims, our action areas, and our enabling tools. And the graphic on the right hand side is effectively a graphic of our roadmap of intention going forward, with sort of annual dates in there. And the reason we haven't given absolute dates is because this is very much intended to be a high level strategy of intention for us as a local authority. And then once we get it agreed, we will start doing the devil in the detail work on each of those different actions, which will then themselves be brought before Health and Environment Policy Committee and obviously Cabinet. So I won't go into each and every one because that will take too long, but yeah, you can see it there, 24 to 2030, just picking out a couple. We're going to start off with source apportionment because we need to know what we're dealing with. That's very much quite a science, and we will need to commission assistance on that. Smoke control areas, identify opportunities to work collaboratively. And that's already started. There's a new Clean Air South group, which has been triggered by, in no small part, with my involvement with the Sustainable Research Institute at Southampton University. So we're looking to try and collaborate with academic institutions and partners and look to other areas that we have traditionally not worked with before because we can't do it all ourselves. And support traffic reduction policies as well. That's quite a big challenge in of itself. So we need to work a lot more collaboratively with Hampshire County Council and the Highways Authority. Get active travel plans and with the intention of reducing traffic flows through those otherwise traditional hotspot congested areas. Ooh. So I could go through each and every one of these. Don't know if you would like me to, but so yeah, source apportionment. We need to expand our air quality network. We're adopting a regional air quality network, identifying and delivering measures at sensitive locations. So we've identified that there are particular micro locations, which is to say there are sites, individual sites of concern. These are schools, nurseries, open air playground areas that we need to raise public awareness in terms of don't idle your engine, by way of example, because it's not good for your kids. And just to do a little bit of citizen science with that cohort of our population, just to raise awareness. Children are great sponges, as you know, so getting them involved is a real sort of, I think they call it pest of power for behavioural change in adults. I mentioned anti-idling. Develop our local walking and cycling infrastructure plan. Cycling and walking infrastructure plan is a real key part of sustainable travel and active travel. Invest and support traffic reduction policies, again, working with our Hampshire County Council colleagues. I think there is a greater awareness of the need through climate change and through public health agenda that we all need to do our part in driving less and taking up local transport options. Domestic combustion, so smoke control areas, looking to undertake a feasibility study consultation into adopting smoke control areas across our district. And also working very much on public education programs on indoor air quality. You may have heard of the sad death of a young boy who the coroner actually pegged the fact that he was living in a really, really deprived, mold infested property as being a contributing factor to his death. So indoor air quality is a real public health concern as well. and to enhance and uptake the use of active travel, as I've said. So rattling through this, there are a lot. This is the last slide, I'm sure you'll be pleased to hear. As part of the strategy, there are a lot of challenges. Air quality touches all of us. Not only do none of us have a choice in terms of what air we breathe, it is the air that we are actually in, if you like, at the time. So we don't have a choice on the quality of air we breathe. It affects all of us. And yet we all, because we live in a carbon-based economy, contribute to the problem. We all jump in our cars. Well, not all of us, but most of us jump in our cars. We start off our boilers in the morning to heat our water so we can have hot showers. All of this creates pollution and contributes to the problem. So how do we tackle that? And really this slide is about sort of really putting out there that it's not going to be an easy task. There's multiple skill sets required. We need to get together collaboratively with our regulatory partners, technical partners, which is why we've got the academic institutions on board, because they're really, really keen to do community-based research. We need to market the message to our communities. We need to, through our collaborative approach, we need to adopt more of a proactive grant bid process, because at the moment there is money in central government, but it's really, really, really hard for smaller districts to get hold of. A lot of the grant funding goes to the big players like your Birmingham's, your London-based authorities, doesn't come down to us. So we need to get better at that. And we need to understand better how we can affect social change. But of course, there's costs, there's political intervention, and behavioural change is very, very challenging. So we've got a lot of work ahead of us. And on that note, questions?
Thank you, David. So just want to get a point of clarification before I throw it open to the floor. Sounds like in previous years when I've heard this, we've been focused more on the AQMA and what's been going on there. What I think you're saying here is that we might be at a point where there is no longer a need to declare an AQMA. That depends on DEFRA's interpretation of the rebuttal. Even if they don't accept the rebuttal, the AQMA area could reduce substantially and just be a chunk of Romsey Road. But that doesn't mean everything goes away, because we've got new standards to meet, and there is an AQS, air quality strategy, which the council needs to implement or create, design and create, and then implement across the whole district. So in a way, we've kind of tackled one thing, hopefully, but then we've got a new thing to deal with. Is
that is a very, very good summary of the situation.
Good. Right. Okay. At least I understood that bit. Right. Thank you. With that, I am going to open up the floor for questions. I can see Danny Lee's got a question. What I'm going to ask this time is that we have one question, not three questions. If you have a second or a third question, you can come back in later, but that way we get around the room quicker. And if we can keep it to a question rather than preamble, we might even have time for a quick debate where we can actually get the points of debate over. Okay, Dan, or Councillor Lee, sorry.
Thank you, Chair, and to congratulate the Air Quality Steering Committee in producing a great strategy. The question I had was linking to our health priorities that we talked about earlier, and I appreciate it's a question of resource, but if we take our PM 2.5s from 10 to 5, my analysis suggests that there's a 23% decrease in cardiovascular hospital admissions and a substantial helping hand to the heart failure rate of by about 38%. So I'm just wondering, is there any chance that we can be more ambitious? And then related to the PMs is I don't see any mention of PM1s, and now picking up on what Hazel was saying, this is black carbon, or what's called synergistic pollution. It's also called a short-lived climate particle, which obviously then has an impact on climate change. And I'm just wondering, and again, I haven't read the strategy in detail, whether this is something that's going to be in the strategy or something we can do something about, because I think it's really quite important to talk about the flip side of air quality, which is climate change. And it's win-win if we deal with both, which then plays into your burning and your bonfires and so on. Thank you.
Yeah, I think this actually falls to me rather more than Jackie, because this is about deliverability. There's no point of setting targets which we have no hope of being able to achieve. It could be that if there is concerted national action, we could get closer to this, but realistically, we know that we are not going to persuade everybody to jump out of their cars while electric cars deal with the NOx problem. They do not deal with the PM 2.5 problem. In fact, if anything, they could make that worse. So we have to look at what we can do, and we need to remember that actually we're talking about relatively small timescales to try and achieve a lot of this. Given how long it took us to even get close to removing our AQMA, I think we have to be sensible about this. But I do think that the WHO air quality guidelines do set an aspiration for us to get to as a country. But we also do need to remember that there are some natural factors. While we talked about some of the ammonia and other issues to do with agriculture, some of it is natural. So there will always be a level of small particulates in the air just coming from our natural environment.
Thank you. Councillor Power.
Thank you, Chairman. I think we need to pay some time to Mr. Tate's point. I've understood that with electric vehicles using regen braking, that does reduce the PM 2.5. I wondered if that was in fact true, and if so, what share would we manage to reduce with electric vehicles?
I don't think we're going to have. It's too difficult to get the exact data on that because it very much depends on the weight of the vehicle. It actually comes more from tyres because brake wear does reduce, but tyre wear tends to increase.
They are looking at the moment at forms of sucking that air away from the tyres as they go. I know that's a new generation that they're looking at. It's an innovation.
I was actually going to go slightly off piste because you referenced Ian Tate's question, which I can answer in terms of electric vehicle charging strategy, because that was one of my bits of work back in 2018. And things have moved on from his statistics as presented. So we do have more rapid charges in the Winchester Town Centre to what we originally delivered. There is actually a drive now towards more rapid charger installation than fast charger, and rapid basically means anything over 50 kilowatt hours charging rate. So we've actually got 2 rapid chargers now up at Wessex Hotel. We are looking to put one in at the Sports Centre as well. That's a piece of work that's currently undergoing, and there is one down in Bishop's Waltham. So these are quite expensive bits of equipment, and to answer the question about why do we not have more, well, it's because they are primarily funded by a private provider, and the private provider will not fund something that costs £50,000-60,000 if the market isn't there to use it. So they won't effectively set aside a rapid charger just for the taxi community because the demand is not there. The original rapid charger that was put up at the Wessex Hotel was the best performing rapid charger on the MER network in the southeast of England, which is great. But it just meant that you couldn't just say one taxi guy use that. It just wouldn't get the income. If you're interested to know the answer to that question.
Thank you for picking up on that point, Councillor Power. Any question? Any further? Councillor Briefing.
I'm just interested in the point you've made about, I suppose, how we can nudge people towards better ways of doing things, and also to Miss Agarbal's point about air quality and wood burners. Do we have a programme of comms in place at the moment? And I suppose the flip side of that is, as councillors, we all contribute things like letters to parish magazines on a regular basis. Can we help signal boost anything that you're doing?
The answer is yes, we do engage with comms. So Harry Osborne in our comms team is very much part of that project. So we have put out multiple channels. So on our social media channels, Hazel is going to be putting in a couple of poster sites, or are they already in? Yeah. Yep. Thank you. So yes, we do have a communications program, but yeah, it's quite hard to land the message to, you know, initiate wholesale behavioural change. I think it's a long term, you know, not to give up on the messaging, but keep it going.
Okay, I'll jump in here and just like to explore a little bit about the sort of background, background contributors to air quality, and to what extent do we understand the sources of the poor air quality, the pollutants. You've mentioned the docks. We've mentioned I think the National Strategic Road Authority. We've clearly got a motorway going around Winchester. A question that the public would have is, if those contributors are like the dominant factors, is there anything we can actually do about it by what we do within the city? So I'm just trying to understand the relative scales of the contributors. Can you help me with that?
Yeah, I mean, I can only sort of answer in theoretical terms, because that's one of the first sort of elements of the strategy, which is to undertake a source of apportionment study, which is essentially what you're asking, where, you know, we monitor nitrogen dioxide and particulates, but we get a figure, but it doesn't tell you out of that figure what comes from cars, what comes from boilers, what comes from, you know, the docks down in Southampton. So it's very much a theoretical based science. I mean, arguably transport emissions are one of our biggest contributors. Static source emissions, so domestic boilers, commercial boilers, are also quite a big contributor of nitrogen dioxide and particulates as well. As Councillor Lerny has said, we've got a lot of 2.5s arising from wheel road interaction and brake dust. But yeah, there are agricultural emissions, which we honestly don't know at this point in time. It's probably also worth just mentioning that at the moment we only monitor PM2.5 in one location. So that's again one of the intentions of the strategy, is to increase our monitoring network. Technology has moved on a lot in the last 10 years, so there are lower cost monitoring solutions that we can try and afford. And increase our monitoring network across the districts. At the moment, it's been heavily focused on the city, but the strategy wants to broaden that out across the wider district.
Yeah, I mean, there's a well-known cliche in business, which is you can't manage it until you can measure it. So you've got to start measuring first, and then understand what the sources might be. So actually, clearly, measuring across the district is a first step in that process. Right. Okay. I've got Councillor Latham. Were you up first? Okay, I think you were. Councillor Latham.
Thank you. Actually, it follows on from what you were just talking about, the resumption of monitoring out in the district. I can't remember if it was in this paper or not, something about citizen scientists, but are you sort of reaching out to like parish councils, local environmental groups and things with some of these low cost, low tech monitoring stations, because that could be a sort of ready-made network to
absolutely
to help.
Yep. Yeah, I mean, we have already engaged with Twyford Parish Council. We've undertaken some monitoring down in Whiteley with our lower cost bits of tech, if you like. So that's already been done. And I mean, one of the areas of the focus on our strategy is to engage in schools, as I say, because the schools are seen as sort of more sensitive micro locations, and they are already an eager base upon which to build that citizen science the kids want to know, and it creates a great project for the school as well.
Councillor Bolt.
Thank you, Chair. It was actually partly the same question that I had as well, so well done for that. But building on that, I wondered what the potential was for schools and parishes, because I know this equipment's shockingly expensive, even the sort of the cheaper end of the monitoring side of things. whether there's any chance that the schools and parishes could get funding, SIL funding, and apply for it through the South Downs National Park, as county have done with the 20-mile-an-hour speeding issue, where they've applied for SIL funding through the South Downs National Park. We might be able to find that we can get some funding for this. Just a thought, and I wonder what. Yeah.
I know that was more of a statement than a question, but I'll just come back and say that that's one of the other benefits of the collaborative working is to, as it were, make yourself a stronger party by joining up with other local authorities. With Southampton University, they've already said that there are sort of scientific technicians within their employment base that are really interested in developing low cost monitoring for us. But also in that collaborative approach, we can tap into more funding streams, because it's not just about Winchester, because we aren't, air doesn't stop at our border, doesn't mix with, it does mix with Fareham, it does mix with New Forest. So we need to work with all our partners and put together joint bids for developing a monitoring network for the whole of the region.
I'll come in with another question, which is in the air quality strategy local authority actions, you talk about the AQS to be informed by monitoring assessments, and then that the DOPH must be involved in the preparation of the AQS. I'm just wondering what, being involved, what does that mean? What teeth do they have? To what extent will they impose certain measures on us? What does that DOPH must be involved mean to us in practice? What does it mean in practice?
So, I mean, the guidance doesn't actually, the legislation doesn't prescribe that, and there is not a lot of guidance. But in practical terms, the way we've addressed that particular point is that we have a member on our air quality steering group from the Director of Public Health's office. So James Moore works for that office. He's also, interestingly, wears another hat. He's a strategic transport planner, so he used to work in the transport planning team. So he's uniquely placed to see both sides of that coin, if you like. And he's been instrumental in feeding into the development of the strategy from day one through that steering group. But what it means in legal terms is that when we go to the DOPH and say, hey, we've got this air quality strategy in minimum terms, they can't just go ignore it. They have to feed back their comments. And if they don't, then we say you've got a duty to do this.
Yeah, and it can demonstrate there's been consultation
absolutely
at that level.
Yeah.
So they can't really complain too much. They can't say at least we've ignored their thoughts. I'll open the floor to Councillor Lee has another question. Thank you.
Yeah, I just want to pick up on this subject of collaboration and costs. The Sussex Air Quality Partnership used to have, I don't know if you're aware, mobile units, which we were able to deploy. Then had a call of contract, I think, with King's College London. So there was a package which allowed you to do proactive sharing. So I think they then collaborated with all the district councils across Sussex, which meant that they could amortize the costs and so on. And I just wondered whether that's a model. I don't know whether it's under a Hampshire umbrella or whatever, but it seemed to have merits. And certainly in my previous life, the Environment Agency, we found that particularly useful. Strengthening knowledge and proactivity. Just an idea.
Absolutely. I've attended that group on 2 occasions. So I'm on their distribution list. So I read all their minutes and I'm very aware that they are held up as an exemplar in terms of working collaboratively. And there are a number of examples. There's Kent Air as well. There are other similar groups up in the Midlands. So that's what we're trying to get towards. But actually, we're being more ambitious because we're also involving, as I say, academic institutions and broader partners as part of delivering our strategy. And the hope is that towards the end of, well, even before, if we can, before the end of this strategy, so before 2030, the hope is to have a regional air quality strategy, whether that's for Hampshire or whether that's a Wessex region strategy, because we're all trying to achieve the same thing. But it's getting it through the political buy-in across multiple agencies. That can be the challenging bit. But yeah, that's the intention.
Okay, I just want to pick up ask a question that might speak to the points that Hazel Agumbar has raised. In the local actions section, there is reference to local authorities consider whether to declare a smoke control area, which I think would probably speak to some of the concerns that Hazel raised. What's involved in that? Can we just decide, or are there certain criteria and that you have to hit before you can declare it? And what's the legislation behind that?
So a smoke control area it's a legal term. It doesn't mean we'll just ban any kind of smoke emissions. There are prescribed requirements as part of a smoke control area, and those in broad terms set out the standard of the appliance that you can burn in, and or the quality of the fuel that you put into that stove. So you've got sort of low, I know Hazel will disagree, but in relative terms there are more lower emission fuels and there are more efficient stoves, and that's prescribed in the legislation. In terms of the process that we would go through, that's very much for us. I mean, if you guys wanted to just state that we're having a smoke control area that covers our whole district, yeah, you could say that, but there's a lot of people that like wood burning stoves, and I know Hazel comes from a different angle, but the fact is there's a lot of people wood burning stoves in our district. There's also a rural community, arguably, who use wood burning stoves. Some properties are still out there that use wood burning as their primary source of heating. So, these are all sort of complexities within the layers of that decision that we need to consider. So, yeah, it would need to go, I would argue it needs to go through a public consultation, I would suggest, before we made any decisions.
Yeah, I wasn't doubting there'd be a political process, but I just wondered what exactly it means. As I say, what does the framework of legislation allow a council to do? If the council was to politically decide, fantastic idea, pay a political price for it out in the rural areas, but what does it mean in practical terms?
Yeah. So I'll make this very quick. Yeah, essentially it sets out prescribed standards. We would probably have a lead-in period until it bites. So we'd use that time frame to undertake a really, really proactive communications plan to our district. There might also be, although you might declare the entire district as a smoke control area, you might have underlying policies of enforcing. So you're not obligated to necessarily take action in having a smoke control area. You might turn around and say, if your only form of heating is a wood burning stove, we will not enforce against you. That might be the other approach.
And I thought, having asked that question, Councillor Porter might want to.
I do. I just, you've asked David quite rightly what legislative process, but I think it's really important to say that all of the steering group felt that it's really important to inform the public about things and take them with you, because it'll make that process much less painful and hopefully improve compliance, because we can't monitor the whole district all the time. So most people don't know and don't have the knowledge that Hazel does, and we all do. And one of those things is we've started with having those regular statements out to the public to say, this isn't good for you. Think about how you actually use wood burning as part of your heating or as part of your fun. And so people have bonfires, people have cook outside, people have wood burning stoves, all sorts of reasons. And then, so that's part of the conversation that we're having with people. Think about idling your car, thinking about these things, making sure people are aware of them, because then we can start saying, once people are aware and they're aware of the damage they're doing, then we can work towards the next stage, which is saying, how do we regulate? Can we regulate ourselves, or do we need regulation to do it?
Yeah, thank you for that, Councillor Porter. I was really just trying to explore the potential there, but not personally actually being very attracted to using. Yeah. Councillor Power.
1 point, Chairman. There are parts of Winchester where people have been without electricity for 2 or 3 days. That is also a health consideration, and then they are relying on their burners to keep warm. And let's not forget that, please. I would also mention I have still got some of the engine off so I don't cough flyers, which councillors can put in their local co-op or other outlets and indeed hand out on occasion.
Okay, any further questions? Councillor Lee.
Just wanted to ask a question about bonfires. Have we looked at the database? How big is the problem in the district? And is there something that needs to be done? Are there any hotspots that highlight where action needs to be taken?
So the legislation currently does not prescribe that bonfires, which is basically an open source combustion of material outside of a incinerator or a chimneyed appliance. So your garden bonfire, by way of a common example, there is no legislation that outright bans that. There is the Clean Air Act 1993 that prohibits the burning of material that is likely to give rise to dark or black smoke. That only applies to commercial premises. Other than that, you've got the statutory nuisance legislation, which prescribes that smoke can cause a nuisance to your neighbours. But the realistic application of that law doesn't really apply to an occasional bonfire. Everybody's, you know, the situation is, you know, if you want an occasional bonfire, it's not illegal. In terms of hotspots, I mean, clearly it tends to have more of an impact in built up areas, and that's where it tends to cause greater offence to people than rural areas because it's more open, but that's not to say it doesn't cause offence. But yeah, it's a difficult one to control without national legislation, I'll be honest.
Okay, any further questions, or shall we move into debate? Anyone wish to get the ball rolling? Councillor Lee.
I just wanted to bring us back to the point I made earlier. The flip side of air quality is climate change. We talked about the short-lived climate particles, PM1s and 2.5s, and then the longer-lived climate particles are also present. And fortunately, the longer-lived climate particles, we're taking action. It's coming down, not fast enough. But actually, the combination of both is something we don't consider. And this is quite worrying. And going back to the point about Hazel made about, you know, wood burners and so on, this black carbon is a particular problem, obviously in urban areas, and certainly where I live, bonfires is a black carbon issue, which is not just a nuisance. It's particles which can be quite thick and fog-like, which is very unpleasant. Thank you.
Councillor Bolton.
So I was part of the air quality group, and I have a bit of a science background, and so I understand some of the science, and I also understand some of the concerns that other members of the public have in terms of what does this mean for me in terms of, you know, the control of what I can do and all that sort of thing. Can I have my log fire at home? You know, and there's something quite natural for a lot of people about having their wood burning stove and that sort of thing. And my feeling about all of this is that you have to understand the science and understand what's going on and measure it so that we can be educated about the effects and in what way that creates risk in our lives. And then we have to decide how much risk are we prepared to take? Are there methods of reducing that risk to still enable people to have certain things that they wish to enjoy in life? But unless we take the steps that have been outlined in this document about measuring more of it and then working towards reducing those risks once we understand what they are, then we'll make no progress at all. So and I don't think we'll persuade people unless we have all that background to be able to say, you know what, we need to do things slightly differently, and maybe some of the old regulations weren't good enough, and we need to move with the science. So I guess what I'm saying is that although I might like my wood burning stove, I'm prepared to listen to the science, and then we can do something about it, and reduce those risks where we find they're unacceptable. That was it.
Thank you, Councillor Bolton. Any further contributions on the debate? Looking round, I think we are done. Just for my own part, I have myself and my family have flirted with wood burning stoves on a number of occasions, but never quite actually done it. And now we've kind of gone past the point of thinking maybe we shouldn't. It maybe not is the right thing to be investing in anymore. But that said, whenever you go on holiday and there is one, it's quite nice to sit around it when it's a cool autumnal day. I think it's good that that we're moving from an air quality management area to a strategy for the district. I think points which I think Councillor Bolton just alluded to in terms of you've got to understand it, you've got to measure it first, understand where the problems are and what's causing them. I think that all makes sense to me. And I think, again, building on what Councillor Bolton said, you've got to have some comms behind, you've got to educate our population such that they can engage with it and make informed decisions as to what they would support. So I think the strategy seems to make sense to me, and I think you're getting consensual support from this committee. So thanks very much for all the work you've done on this and presenting it to us so well. Thank you. Oh, and thank you, Councillor Porter and Councillor Nerney, for your work as well. We now move on. Oh, sorry, thank you very much, Hazel, for your participation earlier on and for making a number of points which then fed into some of the questions we made. I hope you got some of the answers. It sounds like you're very well plugged into David Ingram and others, so hopefully it can be an ongoing dialogue. Thank you. So we'll now move on to our last major item, which is the council plan. And we have Simon Howson, is that right? And Martin Todd. Martin, are you going to introduce it for us?
Yes, very happy to. So we're not presenting you with a draft plan this evening. What we're wanting to do with everybody is get your input as to what you think the challenges are that we need to be taking on, what the improvements are that we need to be making versus the current plan, and what you think success looks like in 2030. And then the other thing that we're trying to do here is not get every single policy and scrutiny committee to answer exactly the same questions. So you are the Health and Environment Policy Committee. So we're very keen to get your input on issues that primarily relate to health and environment. Now, that doesn't mean that we're not interested in other factors, because there will be questions of service performance that might relate to the environment. And similarly, we were saying to other committees that we would want them to be mindful as to how climate change might interact with their area. But from our point of view, what we want to understand from you, so this is very much not about us giving you lots of information, is what you think the challenges are and how we can improve versus where we are now. Simon Howson will take you through the presentation. There's then basically you can then ask about the content of the presentation and the process that we're going through. But as far as we're concerned, it will be most useful in terms of policy formation and setting direction is if you input on the questions that we have for you, rather than fire a load of questions at us. Although as your colleagues on economy and housing discovered, we're also quite happy to answer questions that come our way. But anyway, I suggest Mr. Howson takes us through the presentation, if that's what you wish, Chair.
Thank you, Councillor Todd. I think I'll go with your recommendation on that. Thank you. Simon, would you like to take it away?
Thank you, Chair, and thank you, Leader. It's a fairly short presentation. It will outline the process that we're following for the council plan. And as the Leader's already said, we've got a few questions at the end around sort of direction and priorities, very much focused on the responsibilities of this policy committee, health and environment. So a little bit of background there for members. Council plan, high-level document covering what the council wants to achieve and informs other strategies and plans, including the local plan and the individual service plans. The current council plan runs to the 31st of March next year, and we're looking at a new council plan that will cover the period 2025 to 2030. And as it says at the bottom there, the policy committee is asked to review and comment on the direction of the new plan, including the vision, themes and priorities, but very much thinking and focusing on the responsibilities of this particular policy committee. As I say, a bit of background, current council plan was adopted by council in January 2020. We're now into the final year of that 5-year plan, which runs until 31st of March 2025. This very much provides the opportunity for the council to review those outcomes and priorities for the council and obviously the wider district. The priorities that we set for the next council plan will absolutely be evidence-based, and we've heard a lot about the data sets, the data that's available to us this evening, and mentions of the council plan and how that data provides the evidence, the information to help support those priorities that we set for the next 5 years. I've also made mention there of the recent resident survey that was completed a couple of weeks ago, involvement of members, parish councils, staff engagement, as well as businesses as well. So it's a 5-year forward look to the 31st of March 2030. And it supports the council, and this is an important one, to deliver a balanced budget in the future. So the council plan is not developed in isolation. It's developed with the budget in mind, the medium-term financial strategy, the budget looking forward. The two are combined, look very much together. So in terms of process from here, so committee feedback will be taken into consideration ahead of engagement with Chamber of Commerce, the Winchester bid next week, the voluntary sector, the scrutiny committee discussions on cross-cutting priorities and performance with further consultation during October. There's an opportunity for the draft plan to be considered by scrutiny committee in November, but as already been said, we'll be taking a third dimension, and I'll show you on the next slide, an opportunity for scrutiny in October. Finally, Cabinet in December with a copy of the draft plan for recommendation for adoption at Council in January next year, with the Council plan starting on the 1st of April from next year. So just a little familiarisation there, most of you are aware of the Council plan 2020-25 with a screenshot there of the front cover. A copy there of the vision that we will make a real difference to the lives of our residents, the strength of our businesses and the quality of the environment. We will listen and work alongside the people and businesses of Winchester District in tackling the challenges we face. And in that current council plan, there are 5 priorities. The overarching priority being tackling the climate emergency and creating a greener district. Sitting beneath that, homes for all, living well, vibrant local economy, and your services, your voice, with 4 areas of enhanced focus: cost of living, greener, faster, pride in place, listening better. So they're the priorities that are included in the current council plan. A bit of an outline, a bit more detail on that process that we're following, that engagement phase at the moment that we're working through. So we were here on Tuesday evening with Economy and Housing Policy Committee with that focus on homes for all, vibrant local economy and pride in place. And this evening, health and environment with that focus on living well, cost of living, climate emergency, greener, faster. And then scrutiny committee in October, the overall plan performance. So looking a little bit wider at the plan as a whole, but more importantly, your services, your voice, that 5th priority in the current council plan, and that overarching enhanced area of focus, the listening better priority. I've just listed a couple of questions there, but I will come back to those in a moment, which are looking at what's changed in the last 5 years when we were putting together the last council plan. What are the challenges facing us over the next 5 years? And how well has our current council plan served us? How have we performed against that current council plan? And are there things in that current council plan that we need to maintain and take forward into the new? Similarly, what are the gaps and where are the opportunities? What are the areas that our residents and businesses tell us we need to improve? We'll have the benefit of the resident survey, rich data that will provide the opinions and the views of the residents from across the district. But that's only one part of the story. We're interested to know what others say, and particularly around the business community as well. So what does success look like in 2030? What should we look to achieve? What are those achievements that we can grab hold of and make happen by 2030? And similarly, what are the critical projects to deliver that success? So hold those thoughts for now. We'll come back to those in a moment. So there's a slide there. I won't go through all of them around some of those emerging challenges, and it's very much around the knowns and the unknowns. We've used the PESTLE to inform that, and looking at those external factors that will influence and impact on our ability to deliver the priorities that will be in the council plan moving forward. So new government policies, economic cost inflation, interest rates, place-based budgeting, fuel poverty. Some of those we've heard around this evening in the two presentations that we've had. Social, looking at ageing population, inequality, pockets of deprivation. So a lot of overlap again with what you've heard this evening. So this slide very much is questions on the process. So are there any questions on the process that we're following to develop the council plan rather than questions or comments on the plan itself? I've got another slide after this one, which is very much focused on that. So any questions around the process for the council plan?
Okay, thank you, Simon. I was wondering how we're going to play that, and I was thinking the same thing. Maybe we should first have some questions around process, and then to respond back to the leader. Maybe you want to sort of tease out specific proposals for in terms of answers to the questions that you want. So if we start with questions about process, we'll got Councillor Lee.
Yeah, thank you, Chair. I'm looking at the process on the first slide. It says engagement with Chamber of Commerce, Winchester Bid and VCS. Can you please explain what VCS is? That's what I thought it was. Okay, thank you. And then I thought to myself, great, that's very urban centric, city centric. So how are we going, what is the process in terms of engaging the rural economy, the rural outlying settlements, please?
So the resident survey particularly was 1,600 residents from across the district, statistically representative, with approximately 100 residents surveyed in each ward. So it wasn't city-centric, very much across the whole district with the same set of questions asked. We will actually have ward data once we get the final results.
So there is no organisation.
Sorry, the other thing that we did, the first consultation that we did was we went to the parish meeting, Parish Connect meeting, and had a workshop with the parishes that attended to talk through the issues that particularly affected them. So that was our start point going in to make sure that we were talking to areas right across the district outside the city.
And do you then go back to the parishes once you've got a product which has moved on?
The scrutiny process will happen through the council. I mean, we may do, but I think our main intent was to hear from them what issues they thought were most important, what they thought we needed to be addressing, and it provided some very useful insight.
Okay, thank you.
Councillor Brophy.
Just the point about this process needing to be evidence-based. Just the fact that you're asking us for input on it, and obviously you were bringing an element of subjectivity into it. And it strikes me that our view as members is obviously representing, residents, but are we actually coming from a place of evidence or subjective feels? And it's almost a concern of mine that this process is introducing an element of subjectivity before we see things like the full data from the resident surveys.
The answer is it's a mixture of both. we do expect councillors to have insight into the issues, firstly, that you specialise in as a result of being on this committee and the work that you've done, where you reviewed evidence of our performance and our planning in this particular area. So that's why we're asking about those particular topic areas. But also we do expect councillors to be a voice of what they're hearing from their residents as to what are the most important issues that we should consider. Of course, it is not the only evidence that we're considering. You know, we're considering, frankly, everything we know across the entire organisation. When we think about health, we will obviously be taking into account the presentation we saw earlier this evening. But ultimately, we have to sift through all of that, and I think it is reasonable to seek guidance from committee members on the areas that they specialise in.
Actually, I should clarify. It's really about the weighting of those different inputs, and
ultimately the weighting, the choices. A council planning is not a wholly rational, logical process. It also reflects the values of those parties and representatives that the people have chosen to have control of the council, and so there is an element in which, you know, we will also be looking at promises that we've made to the electorate and how we intend to keep them. So it is, but at the heart of it, what we've been finding in the conversations we've had so far is that there's some very important insights that come out from just starting off from a point of open listening about some of the things that matter to people. I mean, to take an example, one of the things that came out talking to parishes is that when they're thinking about their place and when residents are thinking about their place, they're not automatically thinking to district borders. And in particular, those parishes that sit on the edge of the district, the relationship and the coordination and collaboration with neighbouring authorities is really important. And it's something we touched on in our current strategy, but I think from everything we're hearing, particularly the certain areas which are coming under a great deal of development pressure, it came out as something where we're going, we have to do more on this. We have to, you know, be considering joint arrangements in areas where there's a lot of border related pressure and problems. You know, we mustn't. That came out. That was a point very strongly made by parishes, for example. It wasn't something we thought about. And it's not something which, you know, it's a challenge that we need to consider. It's been interesting as we've been talking about climate change, for example. I think 5 years ago, and one of the questions is how have things changed? 5 years ago, our discussion was about cutting carbon, and that was probably 90% of the discussion. 5 years on, we're seeing more extreme weather. We're seeing flooding, and actually resilience. You know, what's clear is that climate change, the climate crisis, is out of control, or getting close to being out of control, and that we have to work on that basis as well. And that's an example of the what's changed in 5 years, where I think everybody's perspective is helpful and can add depth to the work that we might be doing on strategic planning.
Thank you, Leader. Councillor Power.
Thank you, Chairman. I'm concerned that we haven't really dug into the consultation with businesses. I'd like to know how we are going to consult businesses to confirm that we are going to be consulting all chambers of commerce, because that is strikingly singular in the presentation. And I think we have at least 4 and possibly 5. And whether councillors can help in that process at all. Thank you.
I think that's a very helpful input, and if there are useful stakeholders that you think we need to be talking to, then you know, and where seeking their views will be helpful, then we'll try and do that. We don't want to promise to talk to everybody because we'll get overwhelmed, but I think it would be helpful to get some business perspective from outside, make sure that we are hearing outside the city and not just through Hampshire's chambers of commerce, but maybe more directly from some of our market town business chambers.
Councillor Lee.
Just a quick question on process. I'm looking at the pestle on page 50. Could you just unpick that for me a bit? How was that derived? Obviously, some of that's self-evident in terms of what's the mood music and political terms and so on. So, for example, you know, political, warmer home plans. Well, for me, it's also cooler home plans, given what we just talked about, climate change. and in our housing. And then on the technological pressure on infrastructure, recycling, transport, the grid, for example, seems to be missing, conspicuous by its not being present. So I was just curious how you came to derive that analysis.
So the answer is I don't think it's high science. I mean, the reason why it talks about government policies is that there is a government policy for warmer homes plan and not one for cooler homes. Now, that would be covered by the increasing environmental pressure and is a good example of something that needs to be thought about, and could be a challenge. For example, when we're looking at our housing strategy into the future and how we cope with excessive heating in the summer and the health problems that go with that. In terms of infrastructure, yes, I think actually the version that went to economy and housing did actually make reference to the grid. It's covered there under energy generation and use. But I agree that grid is a huge factor, and actually that again was one of the things that came out when we were talking infrastructure. Is one of the things that came out in very big bold letters from the parishes, for example, and the need for a really robust plan on that. That's something we've taken an important step forward under the local plan process. But again, it's something, 5 years ago we might have been talking about. We were talking about internet a bit, digital a bit, and it was a county priority, so we're probably leaving it to them. Were we talking about the grid when we wrote this plan originally? No, we weren't. Would we talk about it now? Yes, we will, because it's clearly something that needs action.
Semantics, protecting green spaces. Can I make the emphasis again, please, plea for blue spaces as well? It may be semantics, but I think they are different, and the emphasis is important.
I mean, and that's incredibly important, and that's exactly the kind of input that we're after in terms of the rivers. The need to protect rivers going beyond nutrient pollution is incredibly important, and absolutely share that as a priority. And again, if we look at 2030, which is the timetable for this plan, that is a date that figures large in quite a lot of planning for the state of our rivers.
Okay, I'm going to suggest that members sort of segue a bit more into perhaps directly answering or providing an input to answer a question that has been posed by the leader and Mr. Howson here. So we have a number of 6 questions. How have our local health and environment challenges changed since 2020, and so on? I assume that would be helpful to you to sort of have some inputs. It may not be structured, but hopefully you can take notes and then organise it. I almost know for certain that Councillor Lee will be the first to respond. Councillor Lee, I think if you lead on, you can demonstrate the technique.
Yeah, just very quickly. Yeah, obviously, I think the key one is what's changed is this synergy, this interdependence between the climate and the nature challenge, and I think you've picked up on that. That's great. Anecdotally, I think there's another issue on the health side. Interesting enough, in the Meon Valley, I don't think it's up your way, Councillor Bolton, but my residents are experiencing a plague of mosquitoes. Now, I'm not joking. This is causing enormous concern. This is the sort of thing that's coming down the line with warmer climates. We need to be careful, in terms of how we approach things and the challenges we're thinking about.
Okay. Councillor Bolton.
So I believe actually malaria was only eradicated in the 70s from southern England. So I think they've been around for a while. But other things that maybe have changed since 2020, health and environment wise, cost of living crisis, wars in Europe, etc., cost of fuel, and that we've got, as we talked about yesterday, pensioners who are very vulnerable, and so and also people that are have got less money in the pocket. And one of the things that as we talked about when we at scrutiny, when we went over the local plan, one of the things that concerns me is with, very laudable climate change policy, the pressure on, affordable home building seems quite high to me, and things like Letty Standard, all that sort of thing, and the sum total, the aggregate sort of effect of those things. I'm concerned about the ability to provide affordable homes, and I think that is a pressure that is certainly increased over the last 4 or 5 years.
No, it's okay.
Thank you, Councillor Bolton. Councillor Brophy.
I'm just thinking about what will be different by 2030 points. We talked earlier about in the health priorities segment tonight about social inclusion, and I was trying to drive towards the fact that we're often narrowly defining it in terms of elderly people. But I sort of have a feeling that coming down the line, and again, this is my concern, that this isn't evidence-based necessarily, it might be feeling-based, but that young people are getting increasingly socially isolated, particularly by some of the things that we're seeking to celebrate, such as we mentioned the kind of like broadband coming down the line. So we create these wonderful digital havens for all our young people, but we don't have many in real life places for them to gather. And I think maybe a focus moving forward, as well as looking at how we can cultivate the arts, is cultivate in real life places. Interestingly, West Quay used as their advertising campaign, a great place to go in real life, a great place to shop in real life, because that increasing premium you have on finding places to gather. Added to that, you have things like the closing of nightlife in terms of pubs, nightclubs. These are all things I think we've all taken for granted in our lives as places where our lives happened in many ways, whether we remember or not. Whereas if we create and shape a society in a city, or new districts even, which don't offer those opportunities for people to get together in real life, possibly without having to pay a lot of money, given the cost of doing stuff. So I think we'd be talking about this in 5 years' time in the next plan.
Thank you, Councillor Brophy. I'm just going to throw in a few points from myself in terms of what's changed. Sorry? Okay, sorry, I hadn't caught his eye yet, but I think I'm allowed to jump in. And I mean, that's one of the advantages of being chair, is that you can decide where you are on the list, as can the vice chair. I'm just going to put a shout out really for the increased prevalence or visibility of mental health and anxiety among younger people. It might be that I'm biased because I have 3 youngerish people, but I think it is a well recognised trend, and I think I'm not sure how to fix it, but I think it's to the extent that we have levers to address it, I'd like to see that happen. I think we've got a demographic bomb going off that is quietly going on, and it's not recognised as the level of pressure that the non-working people are going to be putting on the people of working age. But again, not sure how this council can address it. There's lots of lobby groups for elderly people, and that's great, and that absolutely should happen. But I don't see quite the same political support for the sort of 18 to 30 group, which historically we've all treated that as your boom years. But I don't see that the level of political support for that. So there's a couple. On biodiversity, I think we are making steps into biodiversity, but I think the people that I engage with on it would say, but it doesn't seem to stop things destroying our biodiversity. So I think we need to do something around either it's part of the education process, or actually maybe, although we've got biodiversity policies, maybe they're not quite working effectively. I'm not sure which, whether it's they're not working, or whether it's the public just not understanding them. Those 3 points, and I'll hand over the floor to Councillor Latham.
Thank you, Chair. Yeah, again, not particularly structured, but just what comes to mind, and to follow on from what both Councillor Brophy and Councillor Crimoyson have said, in health and environmental challenges that have changed, like smartphone use in schools is something that I'm hearing a lot about. You know, again, I've got children that age, but it's something that's around, and you know, the use and the overuse of technology. So that is definitely something that people are trying to work out how to do. You know, I think the first academy switched to no mobiles last week, and you know, this is something that's going on to address that. So it's definitely something that's sort of fairly new. And on the environment, I think that you know, the two parts of the Go Greener Faster plan, making the council's operations carbon neutral by 2024 and the district by 2030, we need to appreciate that the bit that was within our control, i.e. the easy bit, is the bit that's coming to an end, and the next bit is the bit that is, you know, a complete step up in difficulty, and it's not primarily because it's not within the control of the council. You know, ultimately we could have pulled out all the stops to make our own operations carbon neutral. To get the rest of the outside district to the same level, you know, and I realise that it'll be net, so it's not necessarily, you know, affecting everybody's actions. But even so, to get that net number down is going to be a whole completely, you know, step change harder. So I think that needs to be appreciated. It needs acceleration.
Thank you, Councillor Latham. Councillor Bolton, will chime in again.
So sort of, I guess we're sort of working our way down this list a little bit, aren't we, one at a time, and what will be different by 2030. I'm sure we've all thought about this before, but it's got to be said, and fills me with equal measure of excitement and terrified at the same time, is AI, and what that will mean for us in terms of solutions to some of the problems and some of the new problems that will emerge from its use, where you know, there's going to be a new industrial revolution without a doubt over the next, I don't know whether it'll be by 2030, but by the rate at which AI seems to be moving, something serious will change pretty soon. And us having I don't know the answer to this at all, obviously, but us having a better, or tapping into better sources of understanding how AI will impact us, both positive and negative, as a council and the services we provide, I think could be something that's worth pursuing. And maybe, you know, I don't know, tapping into some, you know, sort of consultancies about how that can affect us, and you know, how we can work with it to enable change.
Thank you. Councillor Bennett.
Thank you, Chair. Yeah, so we've touched on this a bit already, but yeah, thinking about climate change specifically, I mean, that's obviously something that's changed since 2020. We've got more adverse weather effects, both heat waves, flooding, and that we can anticipate will only continue and get worse in the next 5 years. And certainly, you know, I talk to residents, you know, localized flooding is something that they will complain about, and you know, I know that the residents of Winchester City are you know, aware of what heavy rain and flooding can do. So that's something that I think we need to be very mindful of, and how we can help with that, but also I think plan for what's unexpected. You know, there's no point mitigating flooding risks at today's level, because we can anticipate that it will just get worse. And leading on from that, Councillor Lee mentioned the mosquitoes. I think we can expect to see other unexpected events like that, explosions of certain wildlife or declines, etc. And how's that going to impact our residents as well? So let's put that out there for thought.
Thank you, Councillor Bennett. I've got Councillor Arroll.
Thank you, Chairman. I wanted to say that I agree that resilience is going to be very, very important in the coming years, because things will only get worse, and the environment, while health, you know, there are things that the government can do. I don't know about a local authority, but certainly on the environment, you know, it is out of control. So, you know, all we can do is mitigate, and keep working towards these goals, which, as Councillor Latham said, you know, getting the district carbon neutral by 2030 would be very difficult indeed. So I just find it very difficult to answer these questions, not having a firm grip on what the local authority can do, as opposed to the county council or government. But I think the world is becoming sort of less stable environmentally and in terms politically, and wars and so on. And so all the things that we talked about earlier on, like anxiety and mental health issues, are just going to get more difficult unless somebody can put a stop to all the ghastly things that are going on in the world. So I don't mean to be too pessimistic about 2030. And I think the health presentation did give some ideas of what can be done to help things. So I'm slightly more optimistic about the health side, what we can do. But I think resilience and mitigation is the only things we can do about environment. Thank you.
Thank you, Councillor Arroll. Hopefully this council will play its role in creating a more optimistic future. Councillor Lee.
Yeah, I just want to go back to the subject of critical infrastructure. If we have problems with water, the water companies man up and provide water, supply chain, if the supply goes down and so on. But what about food? What does that look like in the future? You know, we all know about 3 days supply chain is only 2 or 3 days away from collapsing if it's not sustained. So I don't know what the answer is for that. And then the other thing is to think about the aspects of, we always think about the warm hubs. What about the cool hubs? What, you know, you talk about social loneliness and and isolation, but you know, cool hubs and warm hubs are equally as important. It's that extreme weather at the other end of the spectrum, which we need to consider. And just a quick question, comment about a planning application I saw up at Bentley in East Hampshire, and the plan was going to deliver this development with a village charter, and that village charter was going to have dementia, elderly people friendly facilities, business hub, and so on within the development, but particularly the dementia bit, which clearly, as we've heard earlier, aging population, 65 heading towards 85, a larger segment of our society is going to be in that bandwagon. We need to think about that.
Okay, any further contributions? Just looking down my list of notes here. Anyone else want to contribute to try and respond to any further questions? No, again, shakes of the head. I'm just thinking if there's anything I've written down that is not been mentioned. No, I think we've covered most of it. So I think, would you like to have Leader, would you like to respond to any of these points here?
I'd like to thank colleagues for, I think, for a set of really important and helpful and thoughtful comments. You know, there were a few kind of common themes coming out. It says that we may be living in a more risky world. There could be challenges that relate to, you know, nature impacts of climate change, to the greater instability that we should actually expect globally as a result of climate change, so that we will be in a more risky environment. That has implications for how we prepare for the future. But I think there's also ideas there that were coming forward that have a lot to do with what we are like as a place and what we prioritise and how we think about health. How we think. I was very struck by what people were saying about real life connection, because actually that ties into what we're seeing emerge as a place. You know, people come here for the nighttime economy, to meet people, you know, and have come to Winchester to meet people for many, you know, for over 1,000 years. And some of the languages and challenges that people were highlighting, I think, are very helpful for us to think about as to how we can and the emphasis that we give within our council plan. I found the comments extremely helpful. You know, we need to be thinking about, I think, the points that were made about the challenges our young people face, about mental health, about the importance of connection, the climate change and its much wider implications that just go beyond the immediate hot and cold that we were talking about. And I think AI slightly fits into there's going to be stuff coming at us in the next 5 years, probably more than we're used to. You know, do we need to be thinking about election integrity? What other things? You know, we suddenly find we get 5,000 submissions, very plausible, for postal votes coming through. You know, who knows? I mean, I'm sort of just saying that out of the blue, but you know, there are things that can be happening that will put us under pressure. So a lot of really helpful challenges and thoughts and ideas there, which I've been noting down. I know Mr. Howson has as well. If you have any more, I know I'll be meeting, you know, some groups and obviously talking to my own group, and so we'll be continuing the conversation. And if there are points you'd like to raise separately, you know, it's very much not the intention that this is the last time we talk about it. And the other point I would make is in terms of the discussion about process, I think it was also helpful to say, let's make sure we're talking to businesses outside Winchester as well, and the other inputs and ideas that you had in terms of how we use evidence to drive the plan. So a lot of really helpful thoughts, greatly appreciated. Thank you. I admire your stamina for being able to come up with so much interesting and useful to say after quite such a long and intense and thought-provoking meeting.
Thank you, Leader, and thank you, Simon. I will just obviously point out, as we probably all took on board earlier on in the presentation, there is a public consultation during October in which we can all participate as members of the public. So we get plenty of other bites of the cherry, as it were, to deliver our thoughts of wisdom. So thank you. Well, thank you, members, for participating in each of the sessions this evening. I think it's been a very valuable meeting, if perhaps longer than I'd hoped for at the start. But I thank you for your perseverance. I've got one more item. Oh.
Nearly finished.
Right. Yes, there is one more agenda item. Thank you very much, Mrs. Adie. Just when you thought you could, I was letting you go. Right, the work programme. Noted. Yeah, just well, as you can see, there's additional items have gone onto the agenda. We've got the leisure centre contracts annual performance in December, and we've also got the biodiversity action plan update. If members have strong views of items that they think really we ought to be seeing at the Health and Environment Policy Committee, you can lobby me. You can lobby through other channels, but certainly you can lobby me, and I'll work with Mrs. Adie to see if there's a way of squeezing those things in. Councillor Lee, are you?
Just a very quick question. The question was raised at full council last night. And it's quite important, given community energy and renewable energy conversation, that the response made by the portfolio holder and the thoughts were to put this into the work programme. So I'm not seeing it there. I guess this is still to be scoped. Is that likely to be in this time frame or not?
Councillor Lee, you know what? I think it was only mentioned last night. It's first, in fact, I might.
We're a very agile organisation.
Yes, but maybe even I missed that. So I think we will, it will be taken on board, and we may or may not see it in the, there'll be a response, no doubt, if it was raised at council.
Okay, thank you.
Right, with that, I think I will. Thank you. You can script my ending of future meetings as well, Councillor Bolton. No, thank you very much. It's always in good nature. So thank you very much for participating. Thank you to the leader and Councillor Porter for staying with us to the end. And special thanks to Claire over there for keeping me honest on all sorts of things, and Mrs. Adey for making sure we follow the correct processes and do things right. Thank you. And good